remotely from, thanks for that, Daniela, from the NHS. We're going to pick a role randomly and would walk through the process of applying one after the other, step by step, the things you need to take note of, and so on and so forth. All right. So we're going to get right into it. If you know somebody that should be here, if you know somebody that needs to learn what we'll be teaching today, get them on the call. Good evening, Mistura. Thanks for joining us today. So you know somebody that you think can benefit from being in today's session. I'd advise that you bring them, invite them here, copy the link somewhere, share it with them, and get them on board. Now, what we're going to look at is a lot of people apply to jobs, but it's always a hassle to land interviews. And the reason, if you can't get an interview, your job application process is faulty. Your CV is probably faulty. If you are required to generate a cover letter, your cover letter is faulty. If you are required to generate a supporting statement, your supporting statement is faulty. If you can't get interviews, it's not because of who you are, it's simply because of your CV. All right. So, how do you apply to jobs in a way that you almost guarantee that you get that interview? So, I'm going to walk you through what to do today, step by step. And by the end of today's session, you'd know why you've probably not been getting that interview, even though you've been churning out hundreds of applications. Okay. So, for those of you joining us for the first time, who are we at Tenalytics? Tenalytics is the leading educational technology company, and our focus is to help people land high-paying jobs across multiple regions and multiple areas, especially within the tech ecosystem. We operate out of Alberta in Canada and also London in the UK using our sister company, Amdari. I'll speak about Amdari as we move on today. We have, in the last 5 years, we've helped over 4,000 people with no prior knowledge, no prior background. We've helped them to transition into the tech ecosystem. So we've helped nurses become healthcare reporting analysts. We've helped healthcare assistants become business data analysts. We've helped accountants become agile project managers and so on. And I'll share how we got them to that point where they were able to land those type of jobs. We have over 182 full-time employees cutting across multiple roles and access to over 300 industry experts. And the focus of these experts are to ensure that you are able to transition seamlessly. And of course, we don't focus on the entire tech ecosystem because tech in itself is broad. So we look at areas from data analytics, health tech, does the healthcare data analyst, the healthcare business analyst, the healthcare project manager. We also focus on data science, financial analytics, HR analytics, and so on and so forth. But my session today would focus on the areas that would get you access into visa sponsor jobs, especially within the NHS, for those of you in the UK. All right. Now, if you're not in the UK, but you're in this session today, this is also useful to you, and I'll tell you why. You would get to understand how to do your job matching. That's looking at the job requirements and your CV and identifying if you meet the job requirements. I'd also show you how to tailor your CV to the job itself so that you match the job by at least 90% and above before you put in your application. All right. And I'm also going to show you how to generate supporting statements, cover letters, if that's something that is required for you to apply to that job. And why am I here today? Why should I be in front of you, guiding you through this journey? My name is Adeza Suleiman. I'm a technology expert with over a decade experience cutting across management consulting, data analytics, data science, and data engineering. Over the last 5 years, my focus has been on helping professionals like yourself with no prior knowledge, no prior background to transition into the tech ecosystem. And we've helped over 4,000 people within the period of 5 years. In August this year, 2026, in just about 2 months from now, we will turn six. Tenalytics will turn 6 years. So 6 years of helping people transition into their desired career path. And just like so many of you, my first degree was in industrial chemistry, nothing related to computer science or nothing related to technology. I transitioned just like you did My first job out of the university was as a management consultant. As a management consultant, your role is to help businesses identify problems and solve the problems. But I knew I wanted more. I wanted to see the impact of the work that I did. I wanted to come up with recommendations, present my recommendations to the leadership of the company from a data standpoint. Okay. So, not my own opinion, not my suggestions, but recommendations based on data. And that led me to dive into data analytics. And fast forward about 12 years in, I currently work as a data analytics and engineering contractor in Canada. I've lived in the UK. I've worked in the UK as a customer insights analyst, as a data science consultant, and I've also worked remotely for companies in the US back when I was in Nigeria. I've worked with one of the largest privately owned energy conglomerates in sub-Saharan Africa as a data analyst and also a management information systems analyst. I've worked as a data analytics consultant with FITC. FITC is owned by the Bankers Committee and the Central Bank of Nigeria. My experience spans across over 5 sectors, from educational technology to energy to sports, financial services, which was where I started my career. So I'll be sharing a bit of my journey today as we move on. And I would also share, more importantly, people like you that had no clue, of the tech ecosystem. They had no skills. They came with zero skills, zero experience, and we were able to help them transition. Okay. So I'll show you what they did and how you can also do the same. All right. Now, we have different categories of people here today. And before I go deeper into my session, I want to talk about the real reason many of us are here. Because you sent us this information. You told us the reason why you are here. And this session is not just about talking, we're not just here to talk about the tech ecosystem, how to land a job. For many people, this is about survival. It's about growth. It's about stability. And it's also about creating a better future, getting into a progressive career path. So I know how important it is for you. And for some of you here today, you are already physically exhausted. You are tired of the long shifts. You are drained emotionally because you have to work. Your body has to pay the price for the work that you do. You are physically strained. You have to go to work every day, work longer hours in order to make more money. All right. If you are here today and you fall into this category, I want you to know you're in the right place. Now, for some of you, it's about visa uncertainty. So you've done your master's, you're a dependent, and currently you are watching your visa countdown. You don't know what to do. You're not sure what to do. And you sacrifice so much to move to that country. If you're in the UK, for example, if you're in the US, if you're across Europe, it was a sacrifice for you to move to that country. And you want to ensure you are able to secure your future in that country. You don't want to head back home. If you are here in this session today, you are in the right place. And for some of you, you are simply just scared of starting from scratch. What do I do? How do I start from scratch? How do I go back to doing the things that how do I get a job when I have worked in a different career path? Maybe you worked in the bank in Nigeria, you worked in logistics in Ghana, but now you're in another country and you are thinking if you dive into healthcare data analytics, for example, you have to start from scratch. That's not the case. So if you fall into that category and you're also here today, you're in the right place. So I'll show you how to do about 3 things today. The first thing I'll show you is how to learn. I'll show you how you learn how to land visa sponsored roles, land guaranteed interviews. That's why we're here. How to look for the jobs, how to look for the organizations, which organizations are sponsoring, even though sponsorship today has taken a different turn compared to 2 years ago and so on. All right. I'll show you what to do to land guaranteed interviews. I'll show you that for free. I'll show you how to learn the skills required to land a job, especially a visa sponsor job, and emphasis on learning the skills the right way. Okay. A lot of people learn skills. However, They don't learn the skills in the way that they can do the job when they find themselves on the job on day one. So I'll show you what to do to ensure that on day one, you know exactly how to do the job. And of course, you don't have work experience in that career path. So let's say you've worked as a support worker, as a care worker, as a healthcare assistant, you currently work in the warehouse, you work in customer service. You don't have experience in data analytics. You don't have in business analysis. You don't have in project management and so on. How do you gain work experience? So you can show that employer they are the best candidate for the job. I'll show you how to do that. And of course, I'll show you how to start your journey today. Most importantly, if you want to start today, what do you need to do? All right. Now, first question of the day. For those of you in the UK joining me, is visa sponsorship still possible in the UK? I want you to type a yes or no into the chat. Is visa sponsorship still possible? Type a yes or no. I want our session to be interactive. I don't want to be the only one speaking. I want you engaged. Fantastic. Is visa sponsorship still possible? Alimat says no. Olukayode says yes. Sam says yes, but very hard. iPhone says yes, but very hard. Sam says yes. Ade says yes. Rebecca says for very specific high needs. I love that, Rebecca. High needs. That's skills that are needed in demand. Okay. Erdona says yes, but it's quite difficult. And it's quite difficult today because of all the changes, from the Home Office, increased salary threshold, increased licensing, administrative fees from the companies that want to hire you. So it's a lot more difficult today for companies to say, hey, I want to hire you. I want to, hire an international candidate for this job, or a graduate, somebody who's on a graduate visa or on a post-study visa, or somebody who is a dependent and so on. It's a bit more tough. It's tougher today, right? However, it's very possible. Okay. Different organizations are still sponsoring, and I'll show you a couple of them. But would because of time, the constraint of time, would look a little bit into the NHS. And the reason why I say this is the NHS is the largest recruiter of talents in the public sector. And the NHS would also easily give you sponsorship. Like Rebecca said, if you fall into a high demand career path. Okay, so we're going to take it from that angle, and I'll show you something more important, which is even though there are several trusts, NHS trusts, not all of them sponsor equally. Some sponsor more, they issue more COSs, while others issue a few. So you want to target those trusts that issue more COSs. So you have to be strategic in your approach. Okay. Now, like I said, if you want a stable job that comes with visa sponsorship, the NHS is an organization you want to consider. Once you get in, it's a lot difficult to get fired, except you are totally incompetent or you breach, very serious, you contravene very serious rules within the organization. But once you get in, it's difficult to get fired. All right. And say you have a deficiency in a particular area in terms of your skills, your competence, there are a whole lot of training that goes on within the NHS. The NHS, for example, has over 230 plus trusts within the UK. Like I mentioned earlier, they are the largest, recruiters of talent. They hire the largest number of people within the UK public sector. And of course, the NHS also employs over 1.3 to 1.5 million people across the UK. Now, a lot of people think when you hear NHS, you hear healthcare, it's all about clinical roles, support worker, healthcare assistant, pharmacist, and so on. But that's not the case. You can get a job within the NHS in non-clinical roles as a data analyst, as an information analyst, as a benefits analyst, as a business analyst, as a project management, as a PMO analyst, as a project support officer, and so on and so forth. And we're going to look at a couple of them today. All right. So when you target the right organization and you have the right strategy, you will land jobs, and you would land jobs that come with sponsorship. For example, you have somebody like Olufumilayo. Olufumilayo got a job as an ERP, business intelligence and reporting analyst. ERP, business intelligence and reporting analyst. And this was the reference sent by the NHS to Tenalytics to vouch for Fumilayo, to validate her skills and say, tell me your opinion regarding her suitability for the post. And this happens with any organization that wants to hire you. They will want to validate you are who you say you are, you have the skills to do the job, and so on. So they reached out to me. Hello, Mr. Deza Suleiman. We are trying to recruit Olufumilayo. Olufumilayo was somebody who had no experience. She didn't have experience in anything data. This is a data role. If you do data analytics, you can get this job. Fumilayo joined our data engineering program, and she was able to land this job last year in February 2025. And she's currently on visa sponsorship, doing amazingly well for herself. That's one person. Again, I'll tell you how Fumilayo got this job. You have someone like Zulai. Zulai joined our business analysis program. And in March last year, Zulai got a job as a project support officer. She did business analysis, but she got a job as a project support officer. So how does business analysis translate to projects? I'd also explain that. And I'll tell you how Zulai also got this job with the NHS. You have someone like Ahmed. Ahmed did the health tech analyst program. That's the healthcare data analytics program. And in June last year, he landed a job as a health informatics support worker. Health informatics. Again, this is the NHS reaching out to Tenalytics saying, Mr. Deza Suleiman, we want you to validate. Ahmed has provided your details as a reference. And when we are applying to the jobs, you'd see how you enter your reference details. So when you get an offer, the NHS simply would reach out to your reference. I'm going to walk you through all of that and so on. Okay, so they want my opinion regarding Ahmed's suitability for the role. He came in with no experience. He had no clue. He wanted to get a job with the NHS. He wanted to get a job that came with sponsorship. And today, Ahmed works with the NHS, one of the NHS trusts, as a health informatics support worker. You have Mary. Mary got a job as a junior IT service desk analyst. And what did Mary learn? What skills did she learn? Data analytics skills. And she got this job in May 2025. All right. You have Ade. Ade got a job as a senior project manager. This is a senior role within the NHS. And Ade was able to get this job by leveraging his past work experience. So what we did was we baked work experience related to project management into his past experience. So Ade did not present himself as a beginner in project management. He joined our Agile project management program, and today he works with the NHS as a senior project manager. Then you have Ikmat. I'm going to highlight Ikmat's story, and I'll use Ikmat as a case study because Ikmat, she recorded a video. She spoke about all the amazing things she did, how she got the job, and I'll use Ikmat's story as a journey. I'll use that to drive my session today. Okay. So again, the links to all these interviews and the testimonials, they're all on my slide. If you want to get access to it, make sure you fill the attendance so that you get the recording, you get the slide at the end of today's session. So Ikmat got a job as an information analyst and team administrator. Information analyst and team administrator. What did she do? What did she learn? Data analytics. Okay, you have someone like Ramat. Ramat was a customer resolution agent. She worked with British Gas as a customer resolution agent, but she wanted more. She wanted sponsorship. Targeted the NHS, joined business analysis, joined our business analysis program, and Ramat got a job as a business architect, also with full visa sponsorship. So something I want you to note, if you haven't been noting, because Ramat learned business analysis did not mean she had to get a job as a business analyst. She got a job as a business architect. Ikmat did data analytics, and her job title did not say data analyst. It said what? Information analyst. And you'd see that cut across all the other roles. So that's something you also need to take note of. And this is something very important when it comes to applying to jobs, how to search for roles and how to target specific roles that meet the requirements of your skills at that particular point in time. All right. You have someone like Toyin. Toyin got a job as a benefits analyst, also with the NHS. She did data analytics as well. She got a job as a benefits analyst. Today, Toyin is no longer on this role. She moved from a benefits analyst role and she's currently a pharmacy data analyst. Okay, that's her new job title. All right, I'll show you Toyin's profile and I'll come back very quickly to continue my session. Okay, so we're going to, would switch between LinkedIn and other platforms today as we walk through our session. Okay, so that's Toyin. Toyin also came in, wanted to land a job. She joined our data analytics program. And if you see, this is where she got her job as a benefits analyst. That's the reference you just saw on my slide. Now, last year, February, Toyin moved from a benefits analyst role to a pharmacy data analyst. Again, Rebecca said something in the chat, which was very instructive. It's easier for you to get sponsorship when your role is specialized. The skills are specialized. Not everybody have that, set of skills. You have the skills. And more importantly, you have evidence of the skills of what you've done. Okay. So it's not just about having skills and listing the skills you have. It is about you showing that you've utilized those skills to get specific outcomes, evidence-based outcomes. All right. And we're going to look at all of that during our job sprint. You have Mawutin. Mawutin got a job as a pathology data analyst. Pathology data analyst. What did he study? What did he learn at Tenalytics? Data analytics. Okay. And of course, there are so many other roles. You have Prince. Prince got his job this year in 2026 as an information analyst. And Prince he got a job while he was still undergoing his data engineering program with us. All right. So most of the time you get to realize that most people don't get jobs because of lack of information. They don't get interviews because they lack the required information. And it's important that you know and have the information needed to put in the application, get the right outcome, get an interview. Once you get a foot into the room, you have a 50% chance of getting that job. When we prepare you for that interview, so once you apply, it's a 50-50. It's either you get it or you don't. When Tenalytics preps you for your interview, we prep you for your interview, it increases your chance of getting that job from 50% to at least 85%. So getting into the room is very important. And how you now perform during the interview determines if you get that job or not. So, and of course, like I mentioned earlier, a lot of people think the NHS only comes with clinical roles, nurses, doctors, GPs, pharmacists, biomedical scientists, and so on. No, there are other roles outside that, non-clinical roles, data analyst, information analyst, healthcare data analyst, pathology data analyst. You saw somebody who got a job as a pathology data analyst, right? Benefit analyst, business architect, project support officers, project managers, program managers, and so on. Okay, so these are the different type of roles, and we're going to look at them in detail when we get into the job application. And I mentioned I'm going to tell you how those people got their jobs with the NHS. At Tenalytics, we have over 200 plus, 230 plus alumni working in the NHS. So it's not a fluke that these people get jobs within the NHS. So the question is, how did they get these jobs? So we look at the NHS grades, and then I'll show you step by step how they got their jobs and how you can also do the same. All right. So the NHS grade starts from band 2. Band 2 to band 3, these are entry level, junior level roles, 0 to 2 years experience. So these are for people that just came out of the university. Okay, you probably just graduated, you're an undergrad, a recent graduate, and so on. And you'd see roles like medical records clerk, data entry clerk, data quality assistant, project administrator, and so on. Then you have the band 4 to band 5. These are officer roles, professional level roles, experience from 1 to 5 years. Okay, and you'd see roles like performance analyst, reporting analyst, business analyst, benefits analyst, and so on and so forth. And of course, you see band 6 to 7, which is where you usually want to target. Okay, so anybody on this call would want to target from 5, anything from 5 to band 6 and band 7. That's your target, because that's where you meet the salary threshold. And that's where you start to meet all the requirements for you to get sponsored. Okay, so these are specialist manager roles, and you'd see job titles like the senior data analyst, the project manager, the senior performance analyst, and so on and so forth. And of course, you have the leadership roles from grade 8 and above. So you have 8A, 8B, 8C, and I think up to 8D, if I'm correct. And these are leadership roles that require anything from 8 years and above in terms of experience. And these are your head of departments. These are your associate directors, and these are your directors. Okay, so this would be a little bit out of the scope of most of you. Of course, there might be some of you that have that experience coming from your home country, while most of you who want to get into that new career path for the first time, you're targeting band 5, 6, and 7. Okay, now Tenalytics has over 237 alumni working with the NHS, and they are all on visa sponsorship. And the big question is, how did they get the job? That's the big question. And that's the question I'll be answering today. So I mentioned I'd use Ikmat as a case study. Ikmat was a stay-at-home mom. Ikmat had to take care of her kid. She just gave birth at that time, had to get out of work. So she stopped work for over 2 years. She had a 2-year employment gap. She moved to the UK to complete her master's. While she was doing her master's, she realized that she wasn't learning the things required from the job boards that she was looking at on different job boards. She went to CV Library, she went to read.co.uk, she went to Visa Jobs HQ, UK Visa Jobs, NHS Jobs. She checked all those platforms, and she kept on seeing roles that required specific set of skills, but she didn't have those skills, and she wasn't going to learn them during her master's. So what did she do? She joined the Tenalytics data analytics program. Now, the smart thing that Ikmat did was she did not wait to complete her master's. She joined the data analytics program while she was still doing her master's. And in January 2024, she landed a job as an information analyst. You saw Ikmat's reference with the NHS Sussex Community Foundation Trust, and it came with full visa sponsorship. And of course, I'm going to walk you through everything Ikmat did, and I'm going to play a video from Ikmat much later after the session today. You hear from her yourself. How was the process like, and how did she ensure that she got that job? Ikmat had about three offers and she went with the best one. The best one in the sense that she could work remotely. So it was hybrid. She currently works hybrid where she goes to the office some days and I think 3 days at home and 2 days in the office. So she works hybrid, flexibility with the work that she does, and she's doing amazingly well for herself. All right. So how did Ikmat get the job? Step number one. So this is where if you have distractions, you want to take away any distraction from yourself, get somewhere quiet, make sure you have a notepad, a pen, and you can take things down from today's session. So one of the first things Ikma did, and again, don't forget to get the slide and the recording at the end of the session, make sure you fill the attendance. So one of the first things Ikma did was to get into a high demand career path. You cannot get a job easily if you're in a career path that is not in high demand. If you're not in a career path that employers are looking for, are searching for aggressively. So getting the job in the first place, before you even talk about sponsorship, you need to be in a high demand career path. Because when you are in a high demand career path, you make getting the job 10 times easier because employers are actively searching for you. That was the first thing Ikma did. Like Rebecca said in the chat the other time, sponsorship is tough in 2026, but only for those who have some specialized skills, in-demand skills. So I would highlight 6 skills today, 6 career paths for anybody who wants to land a job in 2026. 2026 is almost halfway gone. If you still want to land a job before the end of the year, then the question is, what career path do you need to focus on? Number one is the business analyst career path. Number two is the data analyst career path. Number three, the agile project manager career path. You have the healthcare business analyst, healthcare data analyst, healthcare project manager. 6 career paths. And if you look at the left and the right, they kind of mirror each other. You have the business analyst and you have the healthcare business analyst. You have the data analyst, the healthcare data analyst, the agile project manager, and the healthcare project manager. So they mirror each other. The difference between the two, the one at the left and the one at the right, is one of them focuses on the healthcare sector. And you'll see why this is very, very important when it comes to landing a job in an organization like the NHS. Why you need to have healthcare experience, healthcare background, and you have worked with healthcare data. Because that's the reason why the NHS would hire you over somebody who has no experience working with healthcare records. Okay, so before I move on, I just want to quickly do a quick survey. So let me know, which of these career paths do you want to get a job in? Okay, which of these career paths do you want to get a job in? It can be more than one, it can be two, it can be three. Just type into the chat which one of these career paths interests you. Okay, let me move back so you can see them again. Olateju says healthcare project manager. Abiola says healthcare data analyst. Edwina says agile project manager. Rebecca, agile project manager. Mrs. Zambezi, data analyst or cybersecurity. Unfortunately, today, Mrs. Zambezi, we're not going to talk about cybersecurity. Okay. Abiola says a nurse turned healthcare analyst. Absolutely. We have so many of them. Healthcare assistants, care workers, support workers who became healthcare data analysts. Okay. Mistura says data analyst, healthcare data analyst. Fantastic. Absolutely fantastic. So that's the first thing you have to do. You choose a career path that is in high demand. Okay. A career path employers are actively searching for. When you've done that, the next thing you have to do is you have to learn the skill. So number two is what? Learning the skill. Not just learning the skill anyhow, learning the skill the right way. And you would understand what I mean by learning the skill the right way shortly. Okay, you have to learn the right way. I've made that mistake myself when I was transitioning into data analytics. And I'm sure so many of you continue to make the same mistake. And I'll give you an example of the mistake. Okay. Now, for some of you, like I think somebody said, I think that's Mistura. Mistura said, okay, not Mistura. Let me check the chart. Okay, that's Abiola. Abiola said a nurse turned healthcare analyst. A nurse, a nurse turned healthcare analyst. Okay. Now, imagine as a nurse, yes, you have healthcare experience, but all you do is bedside care. Okay. You do bedside care, bedside. How do you show to any employer anywhere in the world that you can analyze healthcare data? Because to become a healthcare analyst, you must show that you can analyze healthcare data. You must show that you have analyzed healthcare data. You must show that you understand the type of databases where these healthcare records are stored. So the mistake that I made, and so many people make today, is similar to somebody in a different career path wanting to transition into a specific career path. So I wanted to get a job in energy. I wanted to work in oil and gas. Okay. I wanted to get a job in oil and gas. Let's call it the energy sector. And when I was learning Excel, okay, I was learning Excel. So I wanted to get a job as a data analyst in oil and gas. Okay, of course, oil and gas, I wanted to make the big money and so on. But what was I doing and what did I do wrong? While I was learning Excel and Power BI and all those other tools, I went on YouTube, I went on Udemy, I went on Coursera, I went on all those platforms, but I wasn't getting energy data to work with. I wasn't getting data within the energy sector. I got data like sales data. I worked with sales data. I worked with e-commerce data. Those are the popular, data sets. I worked with retail data, okay, superstore data, and so on and so forth. And then I realized very quickly that, hey, if I get into an interview and they ask me specific questions on how I have analyzed data and I use the insights to drive business decisions related to energy, how on earth would I answer that question? And that's where so many people find themselves. You want to get a job as a data analyst, as a healthcare data analyst, as a, in a different career path, but how you learn matters a whole lot on how you get that job, if you get that job or not. All right. So what did Ikmat do and how did she learn differently for somebody who did not, who had not worked in the healthcare sector? How was she able to get this job with the NHS and convince them that she was the right person for the job? She did two things. Okay. Number one is she learned in a project-based environment. And this means learning by doing the work. So because she wanted to get into the NHS, she worked with NHS data. She analyzed NHS records. She knew the electronic healthcare records that the NHS uses. And she had projects that she had completed using healthcare data. And when she did this, she didn't just keep it somewhere in her computer, save it in her computer. What you have to do is to showcase that work. You must have what? A portfolio, evidence that you've done that job before. There must be evidence that you've done the job. That's the only way you convince a potential employer that you know how to do the job. So one of the reasons why sponsorship, like you said, is difficult in 2026 is because employers see sponsorship today as an investment, no longer as just hiring a candidate, because they have to pay you more salary, 41,700. That's the new general, salary threshold. And if they are to give you 5 years sponsorship, they would have to pay the home office 6,000. Sorry, pardon my handwriting. They have to pay the home office 6,600 pounds for 5 years. as administrative licensing fees, while they still have to pay you a minimum, okay, minimum of 41,700. So it's no longer, business as usual. They have to be sure that you can do the job and you're the right person. So they don't care about what you can do. They only care about what you have done before. All right. So I'll show you exactly what this means. Okay. How do you learn in a project-based environment? For someone like Ikmat, who got a job as an information analyst with the NHS, and how did she showcase the work that she had done by building a portfolio? So I'm going to show you what she did, and I'll come back and walk you through number 3. And at number 3 or 4, I'll take you to the job sprint. So we start with the job application. Okay. So let's see. Let's go to what Ikmat did. So now, if you go to a typical classroom, okay, when you learn, like I mentioned earlier, you don't learn by using any type of tool or any type of data sets. You learn by using the data sets within that sector, the industry you want to get that job in. So when Ikmat was learning, she was working on projects like this. Okay, so this is a project using NHS data, and it is to assess, it's a risk assessment compliance dashboard. Okay, risk assessment compliance dashboard. And what is the NHS trying to do? They are trying to, there's a healthcare associated, VTE is venous thromboembolism. Okay, venous thromboembolism, that's VTE. It is blood clots that happens within, different patients. To prevent VTE, that's the venous thromboembolism, you have to do what? Identify it early. Once you can identify it early, you can start to treat it before it becomes serious. So this is a project where you'll be giving NHS data on patients over the age of 16 and above that had VTE. You'd analyze that data and come up with a dashboard. This is what your class looks like. This is what you do in class. You're not analyzing retail data. You're not analyzing, superstore data and so on. You're analyzing data within the healthcare space. And you're not doing this alone. So if you go to the class recording, for example, this is where you have a professional and expert, where you solve this problem together and you look at the project together and you solve it together, step by step. And at the end of the day, you are building a dashboard like this. If you look at the dashboard in this class, it says NHS VTE Risk Assessment Compliance Dashboard. When you complete things like this in class, and this is a class where you have the opportunity to raise your hand and say, hey, I'm trying to do the same thing you are doing. I have made a mistake. And your facilitator would do what? Would pause, listen to you, take questions. You have the opportunity to share your screen. And the most important thing is, by the end of this class, you would know how to build the same type of dashboard. You don't need to have any experience. You don't need to have any background. We want you to come with zero experience. So when Ikmat completes project like this, what does she do? Remember, when you learn in a project-based environment, you don't save it in your computer and keep it there. It's doing no good. It does nobody any good. What do? You showcase your work to the world. But that's by building a portfolio. And this is what a portfolio looks like. This is a portfolio of multiple projects, healthcare related projects, and also projects in different other sectors. So this is a smoking health risk analysis. This is a brain tumor distribution analysis, public hospital utilization analysis, and so on. The interesting thing is the link to this dashboard, the link to this portfolio, I beg your pardon, would be on your CV and on your LinkedIn profile. So anybody can see. By the time you get my slide at the end of today's session, you can also access this and interact with the dashboard when you click on the link. So make sure you fill the attendance so you receive my slide. So anyone can come here and click on this link, for example. Okay, I click on this link, I open it up. I want to see what the project looks like, and I want to open it up. And this is a project looking at brain tumor, within the brain tumor within different patients and the different levels of brain tumor. So this is a grade 1 tumor. All right. You can see the distribution, the top affected, the part of the brain that is mainly affected, the pituitary gland. I almost bit my tongue right there. Okay, so that's for grade 1. If I click on grade 2, you can see the part of the brain affected is the brain stem, the cerebellum, and so on and so forth. It is interactive. It changes as we interact with it. All right. If I click on grade 4, you can see the grade 4, the total number of patients, the average age of patients that had this type of brain cancer, the average tumor size, the part of the brain affected. These are projects. When you get into interviews, all these things, because you worked on projects like this, it becomes a part of you. You can talk about them. You can tell the story. You can talk about the analysis you carried out. And this is what I call showing that you have done the job before. All right. So when you learn and you are learning using Kaggle data, generic data sets, 1 million plus people are using that same data set. Okay. And it's always very funny to me. Sometimes I discuss with some people, interact with them, and they say, hey, I'm working on projects on YouTube. And when you go to the YouTube projects they're working on, you see the number of views, like 1 million plus, 3 million plus. So you're simply recycling the same project that over 3 million other people have done. And how do you want to stand out when you do that? Okay. So the best way to learn is to what? Learn in a project-based environment, learn by doing the job. And when you've done that job, what do? You build a portfolio to showcase your work. All right. And I've shown you what a portfolio looks like. I've shown you how to learn in a project-based environment. So you complete about 15 to 25 projects. These 15 to 25 projects are not just random projects. These are your experience. The projects you talk about in interviews. When they ask you question, tell me about a time you've worked on healthcare records using Power BI. What were the insights you generated and how did it impact the organization? You can talk about when you worked on that project for St. Luke's Hospital or for Medex Pharmacy or for Heartbeats and so on and so forth. 15 to 25 projects. You can't exhaust even 5 in an interview. Okay, they won't ask you enough questions for you to exhaust even 5 projects, but you have 15 to 25. And that's where you start to separate yourself from the competition. All right. So don't forget, I'm going to recap and then I want to show you the specific skills you need to learn because I've also seen so many people get it wrong. All right. They go to learn skills that are not relevant and waste their time, or they don't learn the relevant skills and they can't land interviews. So I'm going to show you the specific skills you need to learn for the data analyst, the healthcare data analyst, for the business analyst, the healthcare business analyst, for the agile project manager and the healthcare agile project manager. But just to recap, how did Ikmat get her job? Number 1, get into a high demand career path. Number 2, she learned the skills the right way. And what's the right way? Learn in a project-based environment, which is learning by doing the work. And secondly, showcase your work by building a portfolio. Okay, sorry. Sorry for that distraction. I just muted everyone so we don't have further distractions. Now we have 3, 4, and 5 steps. I've shown you the first two steps that Ikmat utilized. We have 3, 4, 5. When we get to 4, that's where we get to the job sprint. We do the application. You see the way Ikmat applied and why she got an interview. And you'd see the reason why she also got the job. Okay, so let's look at the skills very quickly. You have the data analyst and you have the healthcare data analyst. Now, people ask the question, Adeza, what's the difference between the two? There's pretty much no difference between the data analyst and the healthcare data analyst. The only difference, you learn the same tools, you learn the same technologies, Okay, so the data analyst, for example, is learning problem solving in Excel, SQL, structured query language, Power BI for business intelligence, Tableau for data visualization, business intelligence, data storytelling, generative AI for data analytics using ChatGPT, analytics automation using Microsoft Fabric. These are the exact same tools you would learn as a healthcare data analyst. No difference. However, for the healthcare data analyst, 80% of your projects would be what? Healthcare data. So 80% of your project would be healthcare data. 20% would be other sectors. Okay. And the reason why you need to work on other sectors is simply because you don't want to, over niche yourself into healthcare alone. You want a little bit of other areas. And that's why if you look at the portfolio I shared with you, okay, you get to see this is a logistic project. And then you have healthcare, you have healthcare, you have healthcare, you have another e-commerce project. All right. And there's so many other. This is another portfolio by Victoria. You'd see Victoria has, deep care hospital ER visit analysis. If you click here, it takes you to the project. But Victoria still has what? Redux Airline Aviation, and she also has logistics. So in healthcare, 80% of your projects would be healthcare data. 20% will be other sectors. So even if you want to get a job in another sector, you can apply to those jobs. That's the reason why you don't want to, constrain yourself to just one sector. For the data analysts, 80% of your project is in other sectors. And what do I mean by other sectors? E-commerce, FMCG, retail, transportation, logistics, and so on. But because we also know that there are opportunities within healthcare, we don't want you to not have experience working on healthcare data. So we give you 20% of what? Healthcare data. That's the major difference. And what does the data analyst do in any organization? The data analyst uses data to help organizations make better decisions. That's what they do. So if you work in a hospital, you work in any of the NHS trusts, like ICMAT, for example. ICMAT is an information analyst. What does she do? She looks at patient records. She looks at the hospital performance data. She looks at disease trends. She looks at treatment outcomes. She gets those data sets and she helps the organization find out which departments are overloaded with patients. She finds out when the hospital receives the highest number of patients, what day of the week, what time of the day, how do we optimize resources? All right. And she can use those insights to do what? Improve the staffing and also reduce the wait times of patients. So she works with healthcare data and healthcare records. The data analyst, on the other hand, would focus on, let's say, retail. Okay, you work with Tesco, you work with NatWest, you work with Lloyds Bank. You get to analyze customer data. You do customer segmentation. You help organizations understand, oh, what's our top selling products? What are the low performing stores? Which locations generate the lowest, the least revenue and the lowest, turnaround time and so on and so forth? What are the customer buying patterns? Okay. As a data analyst, there is something called basket analysis. Now, if you work, let's use Tesco as an example, or Primark or Sainsbury. If you work in, let's say Tesco, for example, basket analysis simply means, and it's something that you get to learn. Basket analysis is if a customer buys product A, so let's say product A is a pen, what is the customer likely going to buy next? So from the analysis of the customer buying patterns, you would use a tool like Power BI or Tableau to do your analysis and identify when a customer buys a product A, what is the next possible product that they buy? Interestingly, it can be a product B, it can be a what? Let's say a pencil case, just by way of example. And then once you've done that type of analysis and you know what the customer's buying pattern is, that data, that information is used to organize the store. So when you get into a store in Tesco, for example, and you see that there is a product here, there's another product beside it, there is a product opposite it, there's a product below or above, they are not randomly arranged. They are arranged based on the customer buying pattern because they know that if you buy a pen, based on our analysis, there's a likelihood that you buy a pencil case. So they put that pencil case beside the pen. So naturally, you'd go for the pencil case. These are the type of analysis you'd carry out as a data analyst. Customer buying patterns, customer segmentation, and so on and so forth. That's what the data analyst does in an organization. All right. And how do you learn? How did ICMAT learn? 11 a.m. to 2 p.m. every Saturday. That is 3 hours on Saturday. You have a live class. For those in North America, in the US, in Canada, your class is from 10 a.m. to 1 p.m. Mountain Time. So what this means is if I'm in the UK, I can join a class 11 a.m. to 2 p.m. my time. If I'm not available in the morning, I can join the class for those in the US or Canada, which will be roughly 6 to 9 p.m. my time. So I have that flexibility. All right. Every other day, apart from Saturday, you are watching your videos on the LMS, the learning management system. I'll show you what that looks like. So you are watching your videos, you are practicing on your own, anywhere, any day, anytime. You have the opportunity to do that. And the program duration is for 8 months, 6 months learning, and 2 months internship. I'll speak about the internship as we move on. But guess what? ICMAT did not get her job in 8 months. She got a job in 3 months. 3 months. And it might seem, surprising to so many people that how did she get a job in 3 months? What magic did she perform? She didn't perform any magic, and it's pretty straightforward. And I'll explain. At the time she got that job, the NHS were looking for somebody that knew Excel and SQL. These were the particular tools they listed in the job description: Excel and SQL. And within the first 3 months of learning data analytics with us, ICMAT had completed problem solving. She had completed Excel and SQL. She was moving into Power BI. So when she applied, of course, because she met the requirement, she got into the interview, and because she was learning Power BI, she even had more to say. So in the interview, she told them that, hey, when I come in, if I get the opportunity to get into this role, I would convert all the Excel reports into Power BI because Power BI does a better job at managing more data. We can automate the process of dashboarding and report creation. So she was even giving them more things that she was going to do if she got the job. And she got a job in 3 months. So a lot of people always ask the question, do I have to wait for 8 months to get a job? No, you don't. But again, the program is not structured in a way that this is not a become a data analyst in 3 weeks or 4 weeks, unrealistic timelines. It's a become a healthcare data analyst, a data analyst. It's 6 months learning and 2 months internship. But in your third month, we start to light the fire under you to start applying to jobs. All right. So that's for data analytics. Now we move to the business analysis and healthcare business analysis. What does a business analyst do? A business analyst in any organization simply helps that organization identify problems. Businesses are riddled with problems, several problems. So the business analyst would identify a problem, analyze the current state of that particular problem. Why do we have this problem? What's the process? And then the business analyst would work together with key stakeholders within the organization to help that organization to provide a better solution to that particular problem. And I'll give you a very good example. So let's say within a hospital, all right, as a healthcare business analyst, patients walk in. So you can either book an appointment or you can walk in. Now, because there's the option of walking in, you have so many congestions. Okay, there's always congestion in the ER. The emergency room has congestions. It's a big problem. So that's one of the problem that particular, NHS trust has. Now, as a business analyst, what do? You look at the problem and you look at the current state, analyze the current states of the process. So this process of people booking appointments, why don't they book appointments? Why do we have more people walking in instead of booking appointments? And in the process of analyzing that process, you realize that the patients have to call in order to book an appointment. And it's not a very straightforward process. So what do? You recommend to that trust, if it's an NHS trust or any organization, you recommend to them that let us build or let us buy a patient management system. Let's build one. And this patient management system is where patients can book appointments online. Patients can select the dates and time they want their appointments to be scheduled, and they get reminders when it's a day or 24 hours, or they get a call, they get a text message reminder that it is time for their appointment. And by implementing this solution, you're not working alone. You would sit down with the doctors, the GPs, you sit down with the hospital administrators, and you ask questions to understand their own perspective. Then you document what is required in that patient management system. Maybe when you came up with the idea, the only thing you wanted to do is to have online booking. But when you spoke to the hospital administrator, maybe you spoke to one of the GPs and they said, hey, it's important that when a patient books an appointment, it also syncs to my own calendar. So I can see that a patient has booked an appointment. But that was not what you thought before. So you gather those requirements, you document them, and what do? You interface with the team that will develop that particular application. So you're the middleman between the organization and the team, the technology team that will build that particular patient management system. So when the system is built, you would ensure that the staff, you organize workshops and training sessions so that people know how to use it. Customer communication would go out so that so that the patients would know how to use the patient management system. That's the role of the business analyst. That's what you do. And as a business analyst and a healthcare business analyst, you learn the exact same tools and technologies. Again, the difference is in healthcare business analyst, 80% of your projects is what? Healthcare. Okay. So that's the difference. I hope we are all together. If you're following me, give me a thumbs up, type in a yes into the chat. And I know that we are all together and I haven't lost you yet. Fantastic. We have more exciting stuff to still discuss. Okay, more exciting stuff. All right, more exciting stuff. So what do you learn as a business analyst? You must also know how to analyze data, even though that's not your day-to-day responsibility. The business analyst in 2026 must know Excel, must know Power BI, must know SQL. Then you must know how to map processes from start to finish using tools like Lucidchart, Draw.io. You learn project initiation and planning because you're going to manage projects. Okay, you'd learn Agile and Scrum for projects. Again, because you manage projects. You'd learn the software development lifecycle, which is also project management related. You'd also learn stakeholder analysis and engagement, which is also what? Project management related. And that's the reason, because business analysis has you have a few project management skills. That was why this lady I showed you earlier, Zule, did business analysis and she got a job as a project support officer. So now you know the reason why and how that was possible for her. Right? So let's go back. So you learn all these skills, you learn all these tools, you learn all these technologies, you learn how to use Confluence to collaborate on projects, Jira to track project deliverables, Trello to track team members' tasks, project tasks and responsibilities, Azure DevOps to implement the agile methodology on projects. And of course, you learn generative AI for the business analyst using ChatGPT. You learn elicitation, you learn requirements fundamentals, and so on and so forth. You learn the exact same skills as a healthcare business analyst. The difference is healthcare business analysis, you work with what? Healthcare records, and 20% other sectors. So the timeline is also the same. 6 months learning, 2 months internship. If I'm in the UK, 11 a.m. to 2 p.m. If I'm in North America, in Canada or the US, 10 a.m. to 1 p.m. Mountain Time. Okay, which is about 6 p.m. to 9 p.m. UK time. Every other day, anywhere, any day, anytime, I'm on the LMS, learning, practicing, and so on. And of course, we go to the last program for today that I'll be sharing, which is the Agile Project Management and the Healthcare Project Management. So what do they do? Now, remember in the previous exercise, we said the business analyst wants to build a patient management system so that patients can book appointments online. So this patient management system would have different features, different requirements. One of them is online booking. Another one is calendar integration to the patients and calendar integration to the GPs. Another is maybe billing integration. Now, the agile project manager usually would take up the project from that particular, point where the business analyst comes up with the idea. Okay, this is what we want to do. This is what it's going to entail. And then the agile project manager would do what? Take up the project and lead the project to completion using the agile methodology. Now, the agile methodology is one of the most, is the methodology that you get to see within the technology space when you build technology products and so on and so forth. So because this patient management system is a technology product, it's a software, the Agile project manager will deploy the Agile methodology. And what does the Agile methodology say? If we want to use waterfall, we look at all the resources, we look at everything required to bring this project to life. And we see that it's going to take us about 1 year, 12 months. But the Agile project manager would say, hey, we're not going to use waterfall. We would use what? The Agile methodology, which means we're going to break this project into multiple parts called sprints. And the first sprint, let's call that SP1, sprint 1, is let us integrate, let's build the patient management system and let's have what? The online booking. Sprint 2 is where we integrate calendars. And sprint 3 is where we do what? Integrate billing. So your responsibility as the Agile project manager, the healthcare project manager, is you are managing the different teams. You are tracking the deliverables. You are looking at the risk. What could possibly, hamper this project? How do we deliver this system without messing up our client data and so on and so forth? Okay, but you've broken it down into 3 parts. And you are saying that within the space of 3 weeks, we can deliver the online booking. So we're not going to wait for 12 months, 1 year. 3 weeks, we have a patient management system and it has the online booking feature. Would release version 2 in another maybe 3 weeks or 1 month after we've done the integration of calendar. So you do things in a step-by-step approach whereby you don't need to wait until everything is done before you launch the project. That's the agile methodology. So as you deploy the online booking after 3 weeks and patient starts to use it, the GP starts to use it, you get feedback from them. Hey, when I tried to click on this, it didn't work the way I expected. They let you know, and then you go back and you fix those problems. So you're fixing problems as you move on. You are not waiting until after 12 months when you deploy the project, and that's when people start noticing problems and you start fixing the problems. That's agile methodology. So as an agile project manager, you are in high demand. Employers want you because you help them deliver projects far ahead of time, and it is iterative because you don't deliver and that's it. You get feedback, you make adjustments, and it's iterative as you move on. Okay. Again, as an agile project manager, 6 months learning, 2 months internship, you get to learn amazing skills, the same tools and technology for the agile project manager and the healthcare project manager. You'd learn how to use Confluence to collaborate, Jira to track projects, Trello to track projects and team members and tasks, responsibilities, Draw.io, you'd learn how to use Draw.io to map out processes and flowcharts and so on. And of course, generative AI using Chat GPT. All right. So these are the 6 career paths that employers are looking for you today. They're high demand, eligible for sponsorship. And I'm going to show you the codes. If you look at the list I showed you earlier, there are codes right there. Okay, I have codes. You see the codes. For example, if I want to get a job that is as a data analyst, is data analyst related, you see the SOC codes here that shows you that these jobs or these career paths are eligible for sponsorship. Okay, so and how do you get this? If you go to the gov.uk website, you'd see that. I'm going to show you that before we start putting in applications. Or let's just go there now. Okay, so I'm just going to take you there right now. Click on this link. It takes me to the gov.uk website. Okay, it takes you to gov.uk website. Let's look at one of the roles, for example. Okay, now if I'm applying to a job as a healthcare data analyst, I'm looking for a code 2115. Okay, 2115. If I go to 2115, you'd see the broad category under which that job is likely going to be posted. And then you'd also see the breakdown of other career paths. And it can fall under public health analyst is one of the codes. And what you want to look for is what? Higher skilled. Higher what? Skilled. If I get a job as a business analyst or a healthcare business analyst, I'm looking for the code 2133 and I'll see the IT business analyst. And you can see it broken down into multiple other roles, data engineers, data architects, IT business analysts, and so on and so forth. And it is also what? Higher skilled. What does higher skilled means? Higher skilled means this is a career path that is eligible, or these are career paths eligible for sponsorship with no restrictions. So you don't need to worry yourself about the immigration salary list. You don't need to worry yourself about the temporary shortage list as long as it is higher skilled. If you're looking for the agile project manager, that's 2131. 2131, you'd see the IT project managers. And why are they called IT project managers? Because they work on what? IT related projects, just like the patient management system that I explained to you. All right. So that's how you know these are high demand career paths and they are also what? Eligible for sponsorship. So all the codes are there on my slide. Make sure you fill the attendance so you don't miss out on anything. All right. Now, we've looked at number 1, we've looked at number 2, we've seen the skills to learn. Number 3, what ICMAT had to show the NHS is to show them that she had work experience. And when we're applying to the job today, you'd see that the NHS would ask you your previous work experience. They would want to know if you've done these things they want, the essential skills they want, when you look at the person's specification, and if you don't fall within that, and this is not just applicable to just the NHS, any organization, you have to be able to show that you have experience before. If you don't, then you're going to struggle to get that job. You're going to struggle to get an interview. And you see, unfortunately. So how did Ikmat gain work experience? I've shown you she gained experience from the project she completed in class. You saw the portfolio and 2 months internship. And this is where the internship becomes very, very important. You intern with Amdari. Amdari is based both in Canada and also in the UK. So you can say you worked with Amdari, solved all these problems, worked on all these projects, and you can list that on your CV and your LinkedIn profile. And when you request for a reference, your reference comes from either Tenalytics or Amdari, depending on what you have on what you entered, during your application. And when you do the internship, this is where you gain what? You gain communication skills, interpersonal skills, and so on and so forth, team working skills. These are the type of skills, how to work with people with respect and, collaborate with respect and dignity and so on. You'd see that as part of the NHS's, person specification most of the time. They would even ask you situational based questions. Okay, if your manager does this, what do you do? How do you respond? To know if you fit within their person specification for that particular role. All right. And of course, you always would have a portfolio. So if you go to Ikmat's LinkedIn, for example, or anybody who's gotten a job, one of the things you'd see, if we go to Ikmat, for example, one of the things you'd see is you both worked at Tenalytics. And if you go to our profile, you'd see Ikmat worked with Tenalytics as a data analyst. So she could list Tenalytics as her experience. And she could also get a reference when it was time for referencing. Same with so many other people. Same with Ramat. Same with Gad. And so many other people that work with the NHS today. Gad, you'd also see you both worked at Tenalytics. If you go to Gad's experience, he currently works as a data warehouse ETL developer with the NHS. Prior to that, he worked with us as a data engineer. Again, I filled Gad's reference. So this is how you show that you have experience and you can list your work experience with the NHS. That's number 3. If you can't show that you have experience, then tell me, how do you convince me that you have the capability to do the job or you have the competence to do the job? Are you going to tell me what you can do or are you going to show me what you've done? And most of the time, do you know what happens? These hiring managers and the recruiters, they've already seen what you've done. They've gone through your portfolio. They've looked at your, previous experience from your CV and your application, and they understand your capability. The interview is just for them to, validate that you fit the culture and you are who you say you are, and so on and so forth. All right. That's why the experience is extremely important. And of course, the 4th strategy is knowing where to apply and knowing how to apply. And this is where we get to our job application sprint. So how did Ikmat apply to jobs? Ikmat knew exactly where to apply. So when applying, you don't apply randomly. Okay. And most of the time, what people do is they apply to only jobs available on job boards. So you know all the job boards possible and you apply. If all you do is to apply to jobs, you only apply to 40% of the jobs available. So there are jobs that are not listed and there are jobs that you have to target in order to find. And that represents the other 60% of jobs. So what we do at Tenalytics is we have a job board, the Tenalytics job board. We scrape jobs from both publicly available job boards and also job boards that are paid job boards. All right. We scrape those jobs. We vet them that they're the type of jobs you can do, and we send them to you. Okay, I'll show you the job board and what it looks like. And again, when you get to your internship with Amdari, you also have a job board right there. And we also hold sessions where we show you the general job boards and the type of job boards you can use and leverage. All right, we're going to use the NHS jobs, for example. That's where we're going to apply to jobs today. Okay. And so we do all these things and you know exactly where to apply. So if you are a Tenalytics participant, one of the first things you need to do is just go to your dashboard. So this is your LMS, the Learning Management System. All you need to do is just go there. At the left-hand side, let me maximize this a little bit so you can see my screen better. So at the left-hand side, you'd see Job Tracker. Okay, so if I click on Job Tracker, it takes me to the job board. So I have a job board and I have a job tracker that tracks the job I've applied to. Okay, and you see the different jobs in Canada, jobs in the US, jobs in Nigeria, jobs in the UK, those that come with sponsorship. You see everything right here. All right, we have about 141 opportunities right now. These were posted yesterday, Friday the 19th. If I go to the next page, I can see more visa sponsor job. This looks interesting. This is a flight operations data analyst with Jet2 in the UK. It's a sponsored job. So if I click on this, it takes me to the website. All right, it takes me to the website and I can start putting in my application. So this is where you start from. And it makes life a lot easier for you. You're not scrambling everywhere else to look for jobs. You have it readily available. Okay. So you need to know where to apply and then you need to know how to apply. And this is where we get to our job sprints. I'll try to keep the job sprints within 15 to 20 minutes so that we have enough time to wrap up. Okay. So knowing how to apply, I dare say, is more important than everything I've even said before. Because you can do everything, you can be the best in the use of Excel, you can be the best project manager, but if you don't know how to tailor your CV, if you don't know how to apply, how to come up with your statements, your personal statements, and so on, supporting statements, you're not going to get called for an interview. So you might be good and people know you are good, but you don't get opportunities. And I tell people this, the best candidate does not get the job. Getting the job doesn't mean you are the best candidate, but the candidate that positions themselves appropriately for the job would get the job. You might be smarter than me. You might know Excel more than me. But if I know exactly what the NHS wants and I give it to them and I do well in my interview because I've gotten prepped for that interview, I'll get the job ahead of you. Okay. So I'm going to use a tool today. It's called CV Matchly. It's a proprietary tool, an in-house tool that helps you do the heavy lifting of the job application. Okay. And I'll show you when CV Matchly comes in and I'll show you how we can start to tailor our CV to the job and so on and so forth. Okay. Now let's get started. And CV Matchly is, and you can find it. You have to pay for it to use CV Matchly. However, I'm going to be making it free to a couple of you today at the end of our session. So I want you to see how CV Matchly works and the wonders it performs, and then you realize how valuable it is for you to have CV Matchly. Okay. Um, Before we go to CV Matchly, I told you in terms of targeting organizations, you need to know the organizations to target, right? And one of them is, so we have a list right here, and this list contains the different NHS trusts, the number of COS they've issued in the last 12 months, and the month with the highest COS when they issue the highest. So, for example, the Manchester University NHS Foundation Trust has issued 2,570 COSs. And the month with the highest COS is what? November. Bristol is what? October. So if I want to get a job this year and I'm targeting sometime around November, so we are in June, July, August, September, October, 4 months. Okay, 4 months, or November, 5 months. ICMAT got a job in 3 months. So it means I can start my journey today. And within 4 months to 5 months, I can start targeting organizations like the Manchester NHS Foundation Trust, Bristol, and so on and so forth. So we have these lists. I'm going to make the list available. I'll show you the people I'll give the list to as well. We also have top 20 private healthcare employers for sponsorship, right? So apart from the NHS, which is a public organization, you have private healthcare organizations as well, where you can apply, and they also come with sponsorship. You have the sponsorship likelihood, the type of roles you can target within those organizations, healthcare data, IT roles, and so on and so forth. So when you target organizations, you make it a lot easier and streamlined to get the job. You're not just applying, randomly. Now let's go to the NHS. So I'm just going to type NHS jobs. Okay. NHS jobs, hit enter, and it gives you the jobs.nhs.uk. Okay. The jobs.nhs.uk. Of course, if you're in the UK, just type that out. You're going to get it you have it pop up. So I'll click on this. I'll open up this site and I want to apply to a random job. Okay. So from the account creation to applying to the job, we're going to do it together. Now, I haven't created an account yet. I'm going to create the account so you see the way it plays out. All right. So let's search for a role to apply to. So I'm going to click on search, go to search, and let's search for, if ICMAT did data analyst, let's search for a data analyst role as well. So I'll come in here and I'll type data analyst. Okay, hit enter. So there are about 3,240 jobs. Of course, we can't apply to everything. You have to do a lot of filtering to see the ones that are ideal, the ones that are not, the salaries, and so on and so forth. The first one that came up is the clinical data analyst. It looks interesting, sounds interesting. Let's look at it. Okay. One of the things you also want to look at is the salary. Is it above the salary threshold? So this is 39,000 pounds to 48,000 pounds. The general threshold today is 41,700. So it's above it. I can go ahead and apply. It was posted yesterday, so it's quite new and it would expire on the 5th of July. It's a fixed term contract. So when you see fixed term means it's, for a specific period, maybe 1 year or 2 years, depending, usually 1 year, and which means it is not a permanent role. And that's why you see contract. We're still going to open it and see the same. Usually, it's usually the same type. This is permanent, for example. This is a data scientist role. Okay. But I like this clinical data analyst role. Let's check it out and see. Okay. So let's open it up. So I'll open it and we see what the role is all about. We look at the pay scheme, agenda for change. The band is a band 6 role. Remember, I said you want to apply for band 5, band 6, and band 7. So this is a band 6 role. It's a fixed term contract, and we can see duration is for 12 months. The working pattern, full time. It has a reference number. Now, this is where a lot of people drop the ball when it comes to applying to NHS jobs. They drop the ball. Okay. You don't look at the person's specification and you don't look at the job description. If this is you, I don't know how you want to get that interview. You have to look at the person's specification. It's absolutely important, absolutely critical that you do that. Okay. But now this is where, how do you look at it? When I say you have to look at it, not just look, you have to make certain, you have to use it, analyze and utilize. And that's where CV Matchly comes in because there are just so many documents you can read. You can't read everything. Okay. So you need to utilize some AI to help you out. And that's where CV Matchly comes in. And CV Matchly was designed in-house. It's an in-house tool, a proprietary tool, and it does an amazing job for you. It takes this person's specification. We're going to look at it. It takes the job description and it does what? It helps us to generate our supporting statements and so on. All right. So I look at the job responsibility. You are going to act as the specialist clinical data analyst. Clinical data analyst for urology and so on and so forth. Remember, there was a Mawutin that got a job as a pathology data analyst. This is a clinical data. This is a clinical data analyst. Somebody muted me. I think that was by mistake. I want to be sure you can all hear me. All right. Okay, so brilliant. Clicked on the attendance form by mistake in the chat. Okay, so this is a reminder that you should fill the attendance. I was trying to check the chat and I clicked on it by mistake. If you haven't filled the attendance, make sure you do so you get the recording of my session today and so on. Okay, so now what do I do from here? I read the job summary, but more importantly, I'm going to read what? The person's specification. So I'm going to click on it to download. So let's download and let's open it up and let's see what it looks like. So this is the person's specification. And we're going to look at it in detail. I'm going to try to be fast because of time, but at the same time, I would highlight a couple of things, especially given the reasons why people don't get jobs. You see everything in this person's specification. Everything here, both essential and desirable. You must have it in your application. So when you look at where this is found, here they said a degree in a relevant subject. Example, data science, health informatics, life science, mathematics, computer science, or equivalent experience. They're not necessarily saying you need to have these particular degrees. What they are saying is, show me that you have some training, you have some level of, experience and understanding in relevant areas for this job. Show me you know how to use data analytic tools and skills and so on. And where will this be assessed? Through the application form and also through the interviews. Is it essential or desirable? It's essential. So you see everything essential. You can't run away from it. You must follow. Okay. So they want, what they really mean is that we want somebody who understands data analytics. We want somebody who understands databases and so on and so forth. Here, there is evidence of continuing professional development in data analysis, informatics, or NHS data standards. Again, this is through the application form and the interview, and it's also essential. So what do they want from you? They want to see proof that you've done some learning, you've had some training, you've worked with NHS data, and this is where your learning with analytics becomes very important. You can show them you've done all those things, and your experience is with Amdari. So when you get a reference from Amdari, you indicate that you learned from Tenalytics. Here they want advanced training in SQL, data analysis tools, or database management. So show me where you have utilized different things in SQL, joins, aggregations, window functions, and so on and so forth. So you must go through this person's specification one after the other. Experience in what? Power BI, Tableau, dashboards. There is nothing you are seeing here that you did not see. Okay, let's look at it one more time. Power BI, Tableau, and how to build dashboards. So you are building dashboards with Power BI and Tableau, right? And if you scroll up, you also get to see what? SQL, knowledge of SQL. If we go back to the data analytics skills that you're going to learn, and the reason why for somebody like Ikmat, she got this job easily. Let's go back to the healthcare data analytics program or the data analytics program. What do you get to learn? SQL, which was a very important, it featured in that job. Power BI, Tableau. These are the major technologies that they need. We did not even see Excel. They don't want Excel. They didn't mention Microsoft Fabric. So you have the skill to apply to this job. Okay? They want to ensure you understand the GDPR. And these are the things you get to learn in your healthcare data analytics program. The GDPR for the UK, HIPAA for the US, and FIPA for Canada, data privacy, and so on and so forth, data management, data regulation, data governance. All right. So you must look at this thing in detail and understand what it means clearly. What are the essentials and what are the desirables? So once you've looked at that, we go to the job description. Okay. So let's open up the job description and let's see what the job description looks like. Again, I can review. You can review using ChatGPT. I have prompts you can use. However, CV Matchly does a far better job because you want to use a tool that doesn't give you out as I've gone to use AI. Even though the NHS doesn't frown against the use of AI, they actually would ask you if you used AI or not. Okay, and it's not because they ban the use of AI or frown, on the use of AI. They just want to know if you've used AI at some point. So this is the job description. It's important to look at the summary. You look at what is essential. We've seen that in the person specification, SQL. We saw, Power BI and so on and so forth. Um, the main duties and responsibilities. What else? The working conditions, and you go through this in detail. If you don't do this, you stand the risk of not getting the job. And if you are somebody who has healthcare experience, you are a nurse, you are a support worker, you are a care worker, you are a nursing assistant, you have a far better advantage. So you have a head start. Ikmat had no healthcare experience, but she was able to learn everything, during her classes and projects and so on. But if you have healthcare experience or you already work with the NHS, you have a better advantage. And one of the things you'd see the NHS would ask every single time is, do you work in any of these, trusts? Do you work in this trust or do you work in any of the NHS, trust and so on? They would ask because they want to know if you already work with us, you get a preferential treatment if you have the ability to do that job. And there are people that have done that. They've transitioned within the same NHS trust. They worked as a healthcare assistant. There was a lady who is Kenyan. If I have the opportunity, I'll check if I have a slide, on my deck and I'll show you. She was a healthcare assistant and she wanted to transition. She joined our business analysis program. And within the space of about 3 to 4 months, within the same trust, she got a job as a business data analyst. All right. So these are the things you have to do preliminary, go through all these things, and there are prompts you can utilize on ChatGPT. I'd probably share those prompts with you and you can do that. However, why use a prompt when I can utilize CV Matchly? So this is what we're going to do. Okay, I'm going to create an account because I want to apply to this job. So let's do that very quickly. I want to apply. So I come in here, click on apply. It will tell you are leaving the NHS jobs. You're going to track the jobs. So I click on continue to third party. Okay. So I'm going to create an account. Okay. So let's create an account. I'll enter my email. I'm not a robot. Create an account. Let's do that very quickly. Okay. We've emailed you. So they've sent me an email. Let me check the email they've sent to me. And let's apply to this job. And you'd see the difference between getting an interview and not getting an interview. All right. So let me copy the link right here. So they sent me this link to click on. Yeah. So I'm going to create a password. All right. So I'm just going to I'll use this password that they've created for me and I'll save the password. Okay. So I don't want to waste time trying to think because it's usually very tough. You have to think of numbers, characters, and so on. So title, I'll enter my name, first name. Let me use Adeza Suleiman. For those of you that don't know my middle name, now you know my middle name, Suleiman. Country, United Kingdom. You can search for the address if you're in the UK, for example. I'm just going to search for the address, BD6 1QN. Okay, so you enter your address, it automatically would enter it for you. County, West Yorkshire. Telephone, you can enter your phone number, create account. Okay, so it's pretty straightforward. I don't know if I didn't save that password. Okay, add username. Adeza Suleiman at gmail.com. All right, because I don't know the password I used, so that if I come back later, I can access. So are you an internal? Can you see this right here? Are you an internal staff member of the university, hospital, and so on, so on? Okay. I'll select no, I'm not. Are you currently an employee of the North Bristol? No, I'm not. Are you currently an employee of any NHS foundation, any NHS organization? No, I'm not. So like I mentioned earlier, if you currently work with any of the trusts, you have a preference. Okay, you have a preference. So it's good for you if you already do and you want to transition. And most of the time, what we see happen is they still maintain your sponsorship. So it's transferable. You don't have to start counting from, scratch again. All right. Um, okay. So let's continue. Let's continue with the process. Are you? No, 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 no. Now choose your immigration status. Choose your immigration status. I'm a British citizen. I have a global talent visa. I have a student visa. I have a graduate visa. So maybe you have a graduate visa, you have a dependent visa. I think it's somewhere here. Yeah, I have a dependent visa is somewhere here. Click on that as well. Or you are a graduate, you click on that. And if you wish to provide any additional information, so I always recommend that you provide additional information. Okay. If you can, provide additional information. Okay. So I'm going to tell you what to add when providing your additional information. What type of information should you add or should you include? So I'm going to show you what to use. Just give me 1 second and I'll show you what to use. Because you want them to know that that you have, apart from the fact that you have a graduate visa, you might want visa sponsorship in the future. Okay. You might want visa sponsorship in the future. So I'll show you what to do very quickly. Just give me 1 second. So what you want to do, you can type something like, I currently hold a UK graduate visa. Okay. I currently hold a UK graduate visa with full and unrestricted right to work. So you want to show them you have the right to work. That's clear. I can start work today if you want me to start. Okay. I have the right to work in the UK until when? So your visa expires in 2 years or 1.5 years or so on until June 2028, for example. Okay. I do not require sponsorship. I do not require sponsorship at the moment. Okay. And can commence employment immediately. I don't need sponsorship at the moment because I can start work. And the reason why you want to do this is simply because if you indicate that you want sponsorship, they might think you need that sponsorship in order to start work. But you tell them you can start work today. And in the future, I would be eligible to switch to a skilled worker visa. okay, to a skilled worker visa. So in the future, I will be able to switch to a skilled worker visa. And I've read now, why do we know? Why do we think this job also has sponsorship? Let's even check and be sure. So usually it would be somewhere at the bottom, okay? Certificates of sponsorship. All right. Applicants from job seekers who require current skilled, worker sponsorship to work in the UK are welcome and will be considered alongside all other applications. All right. So you usually get to see that if it's not there, there's a chance it might not be eligible. But then again, CV Matchly can also tell you if you are eligible or not, or if the job is eligible for sponsorship or not. All right. So let's go back. Now let's click on continue. So they're telling me your answers indicate that you do not meet the mandatory requirements for this post. And this is the question that is causing the problem. Are you an internal staff member? Aha. So what is going on here is simply the fact that they want internal candidates to apply. Usually they might do this for the first 1 week or 2 weeks of application, and then they start to take the general applications, or for the entire duration of the vacancy, they want internal staff to apply. Okay. So this also shows you that if you currently work in the NHS, you stand a good chance of easily transitioning. If you don't, all you need to do is go back, go look for another job and apply. But I think what I'll just do, so we don't waste time, since I've started with this one, I'll just answer yes, yes, because so that we can move on and we see the main thing we want to see from here is how do you answer specific questions? How do you write your supporting statements and so on? Okay. So I come in here, I'm just going to say yes, yes, and then I'll go to select graduate. Okay. And I have to type the same thing again. So you saw what I typed the first time, so I'm not going to type everything again. I currently hold a graduate visa and can work immediately. Okay? With no restrictions. With no restrictions. All right? In the future, I would be available, or I would be eligible. I would be eligible for, I would be eligible for a skilled worker visa. Oh, we didn't put a timeline here with no restrictions. Okay, so we need to show that I have the right to work immediately with no restrictions until June 2028. Okay, so the first one was more comprehensive. You can use that one, it's more straightforward. Okay, so it's more straightforward. You can use that. I've read and I'll click continue. All right, so let's see. It takes us to the next page. Yes, it does. So here we start entering our personal details. So you can see the sections: personal details, application questions, references. So when they reach out to Tenalytics for a reference, or Mr. Adeza Suleiman for a reference, this is where you add your reference. Okay. Then equal opportunities and then submit. So let's fire on and get this done in 10 minutes. So personal details, I'll start. What's the personal details? Open this up. Usually it's pre-filled for you based on how you created your profile. Okay, Mr. Deza Suleiman, address, phone number, your UKNI. Okay, so you have your UKNI. Make sure you put it there. I'm not going to put mine right now, but make sure you put your UKNI. Very important. So preferred employment type. Remember, this is a contract fixed term role, but they're asking, what's your preferred employment type? Okay, what's your preferred employment type? So what I want to say is, I'll just simply say, I'd prefer it is full time, and I'd also prefer if it is agile, working from home and so on and so forth. You can select multiple options, or you can, select only one, but you have to select something. You can see the asterisks. So I click on save and move to the next one. All right. So here they're asking relationships. If you are related to a director or have a relationship with a director or employee of an appointing organization, please state. Now, it's important that you answer these questions truthfully. Okay, be as honest as you can when responding to these questions. Okay, so here I'm simply going to say no, none. Okay, I'll just type none. I have no relationship with anyone in the NHS. I don't have um, I don't have a brother, a sister, a family member, and so on. If you do, you can type and write, my sister is employed by the North Bristol NHS Trust as a nurse, as a staff nurse with the medicine directorate. She has no involvement in this recruitment process. Okay, or he has no involvement in this recruitment process. Always state things like that if there is any need for it. Okay, so save and move to the next. So here we have Rehabilitation and Offenders Act. Do you have any criminal records and so on and so forth? That's what this is pretty much saying. Have you got any criminal convictions? Do you have, this means you are not eligible. You read it, okay? But in summary, what they're trying to say is, do you have any criminal conviction and so on? Okay. No, I don't. Save. Yeah, so personal is done. Mark section as complete. Okay, personal details is done. You can edit your, entries later. Now let's go to the application questions, and I start this right here. Okay, now this is where it gets very interesting. Okay, so they're going to assess our education, assess our relevant training, our membership, NHS service, employer activity and history, gaps in employment, supporting information. All right. This is where so many people fail. Education, professional qualifications, relevant training. They fail right here. A lot of people fail right here. Okay. So let's start from the first. Open. So they want you to enter your education. All right. So maybe you have an MSc, you're in the UK to study and so on. You enter your qualification and the subject. So let's say you did a master's in public health or MSc public health, as the case might be, or whatever it is, just write it there. Okay. I'm just going to use this as a placeholder. Place of study, University of Bradford. Grade and results, distinction. Okay, or whatever it is, just put something there. Year obtained, 2022. You can add more. Okay, you can add more, education if you have more from BSc. It's always preferable to start with the most recent. So if you have a PhD, you have a master's, you have an MBA, and then you move to your undergrad and so on and so forth. Okay, so you want to do that. Very important. All right. And let's save and move to the next. Now you have your relevant training courses attended. Do you know the reason why they're asking for this? If we go back to the person specification, remember, under education, training, and qualification, you must have something related to this. You must have evidence of continuing development. And it is what? Essential. You must have advanced training in Excel, data analysis tools, database management. It is what? Essential. So this is where you start to mark yourself and you know if you get called for an interview or not. If you have nothing to put here, I'm sorry, move to the next one. Okay. So this is where you want to enter your course. So let's say you've done healthcare data analytics with Tenalytics. You write it. Healthcare data analytics. Training provider, Tenalytics. Now you might be wondering, Tenalytics Incorporated. Why is it important for me to write Tenalytics? Is Tenalytics qualified? Are they of global standards? So I want to show you this very quickly, and then we'll go back to continue. So Tenalytics is accredited by the CPD in the UK and also the American Council of Training and Development. So what that means is this. If I click on the CPD accreditation, it takes you to the CPD UK accreditation, okay? CPD UK. Now, this shows that your training, your certificate meets international professional learning standards, global standards. So if you click on this link right here, it's going to take you to the CPD Analytics CPD Standards Office, accreditation, and you can read about it. Okay, you can read about it and see what we are credited in providing, the training, skills in what areas, and so on and so forth, and what this is all about. Okay, and this is something that shows if I list this and they even want to verify, is this an accredited training institution that can provide learning for continuing professional development? That's what the CPD is. Absolutely. Analytics is. All right. So you enter that duration, 8 months, year completed, you enter the year 2025, 2026. Okay. Save and move to the next. When you do this, you know that when it comes to this person specification, tick, you've gotten it right. This one too, tick. These are evidence. And of course, here too, tick. So in your supporting statement, you would also start to indicate how you meet these, qualifications, or how you fit into this criteria. Very important. You talk about that. Okay. If you have a postgraduate, that is desirable. It's not essential. So you don't need to worry too much about that. Okay. So let's go back. Save and move to the next. Membership of professional bodies. Are you a member of a professional body in the UK? If you are, yes. If you are not, no. I do not have, just not required for these posts. Okay, not required. Is there any professional? There is no professional body, member of a professional body that they required or they requested for. If you look at that, let's see. There is none. Okay, so you don't need to put I don't have. You can simply put not required. Provide details below, none. Okay, save and move to the next. NHS service. Okay, I think because I selected yes at the beginning, so this is simply asking me, okay, when did you start working with the NHS? So for those that worked in the NHS, all right, you want to put something. Now, for the training attended, if you haven't completed, you can simply put expected completion, August 2026, expected completion, November 2026, December 2026. Okay, so you can always make adjustments to that over here. All right. So here I'm just going to select a random date. Let's say January 2025. Months since most recent, 0. Okay, save and move to the next. Now, employer activity and history. Now, this is another place where if you don't have experience, so when you see candidates like GAD that listed Tenalytics, or you see candidates like ICMAT that listed Tenalytics, or you see candidates like Ramat that listed Tenalytics as work experience, this is the reason why you need to provide employer records that show that you've done that job before. Okay? If required, please provide additional information regarding your employment history within the supporting information section. So in your supporting statement, you must also include, because if you don't have experience related to the person's specification, work experience, looking at the requirements, significant experience working with complex data sets. When did you work with complex data sets? Was it when you worked as a care worker? Was it when you worked as a nurse? No, you must have worked with a complex data set before, or with a set of complex data sets. Where did you do it? If you don't have, guess what? It is essential. Experience with SQL and other database or other database management systems. Have you? If you haven't, so you start to mark yourself step by step. Okay. So let's go back. And this is where CV Matchly would come in. So you see where this is very important. So employer name. Now, because you have listed Tenalytics as your training, it would be weird to list Tenalytics as your employer again or where you worked. Okay. So what do you want to do? That's where Amdari becomes important. Okay. Amdari is where you do your internship. So I'd enter Amdari Incorporated. Employer address. You enter Amdari's address. You can type, and I think it's going to pop up if I'm correct, or I'm just going to copy and also Amdari is 128 City Road, London, EC1. Okay, EC1V to NX, United Kingdom or UK Kingdom. All right. So you enter the address, type of business. You can simply just put it's a data analytics consulting company. Okay, data analytics consulting. Reporting to who are you reporting to? I was reporting to head of analytics. I was reporting to the co-founder and so on. Okay, so let's just put head of analytics. All right, telephone, you enter the phone number. Let me just enter a number. It's 883-460-79. Okay, what was your job title? Okay, what was your job title? My job title was a data analyst. My job title was a business intelligence analyst. I want a title that is close, that looks like, the job I want to apply to. That's a clinical data analyst role. Now, if you did the healthcare data analyst, you can say healthcare data analyst, or you can simply just type data analyst. Okay, healthcare data analyst. Start date, let's say June 2026. End date, December 2026. Grade. So what's your grade level? If there are grade levels there, you can put, if not, you can put NA. Okay, so I'm going to put NA. All right. Salary, or you can put associates, you can put you have associates, senior associates, and so on, or you can just put NA. Salary, were you paid while you were working with Amdari? No, it's not a paid employment. Now, a lot of people think if I don't put salary, I might lose the job. You won't lose the job. And I'll show you an example. Okay. So this is a lady, Toyin, who is currently a pharmacy data analyst. If you look at Toyin's, the reference she filled it as a volunteer, which means I wasn't paid for the job. All right. And she got the job as a benefits analyst. Okay. She got the job as a benefits analyst. If you remember Toyin's profile, I showed you earlier, Toyin Eleja. That's Toyin right there. She got the job as a benefits analyst. Okay. So a lot of people think, oh, I have to put something. No, you don't, especially if you can't prove. So you don't want to misrepresent anything. So I'm going to put NA. Period of notice, I'll put 2 weeks. Okay. Reason for leaving, we can simply just say career progression. Okay. So career progression into healthcare analytics with the NHS. Okay, that's if you are still on the job. If you are not on that job again, why did you leave the job? You enter that right there. Now, this is another beauty. The brief the description of your jobs and responsibility, your duties and responsibilities, maximum 500 words. Brief description. Okay. Now, this is where not ChatGPT this time around, CV Matchly. Okay. So I'm going to guess CV Matchly, and CV Matchly would help me out with this. CV Matchly would help me out with this. So remember, let's go back to the job description. This is the job description, right? I have CV Matchly installed. Oh, I wanted to show you without, let me see. Remove from Chrome. Let me remove it. So I want to show you how to get CV Matchly. If you don't, that's especially if you want to pay for it, how to get it and pay. But if you want to get it for free, I'll show you how to get it for free before we wrap up today. All right. So if you go to Chrome Store, the Chrome Store extensions, all right, and you go to the Chrome Store extensions, search for CV Matchly. But for those that are registered with Analytics, you have it in your dashboard for free. Okay, so I click on CV Matchly. That's it right there. Add to Chrome, add extension, and it adds it to my, Chrome for me. So it's there on my Chrome right now, and it can look at jobs, it can see the jobs, and it can tell me if I should apply to that job, if I meet the requirements or not. Okay, so let me open up. I've added it to my extension already. So let's open up CV Matchly. I'm going to log into CV Matchly. Okay, so let's log into CV Matchly. All right, so we are logged in. Now, I'm going to upload my CV, okay, because I want to use my CV I want to match my CV to this job. Tell me how much I meet the job requirements, okay? If I don't meet the job requirements, help me get there. All right, so let's upload. I click on this, click to upload. Yeah, let's go. Okay. So I'll upload the CV that I want to use. CV Matchly normally is meant to automatically extract the information here because I had opened it up before I, installed. So what I'm going to do is I'll just simply close this. I'll bring it up again. Let's open it up again. Okay. And this time around, CV Matchly would recognize it. Okay. So I'm going to open up CV Matchly again, and it's going to automatically capture the what? The job description. Okay. Automatically captures the job description. For some reason, it's telling me 0%. So let's do it. So usually what happens is if you use CV Matchly for the first time and you already have that job description open and you install it on top of the job description, you might have the same problem that I have here. All right. So what I'm going to do is I'm going to close all of this. Okay. I'm going to close all of that and I'll reopen it again. Or maybe I'll reopen it with a different browser this time around. But let's reopen it again. I'll close all the NHS stuff I have opened. Let's close this as well. I can leave this open. I can leave this open. So let's try again one more time. Okay, NHS jobs. If this still gives me problem, I'll just use a different browser so you see the way it works. Okay, so data analyst. So let's open this. All right, so that's the same job. Let's go back to CV Matchly. Re-upload CV. Let me re-upload that CV again. Analyze CV and let's see what we get this time around. If it works out, else I'll just use a different browser and would see what pops up. Okay, so it analyzes the CV based on the job description that you have and tells you by how much you meet that job requirement. Should you continue applying? Aha. So it has analyzed my CV and I have 59%. So this means the CV I used to apply or the CV I uploaded is what matches the job requirement by 59%. If I apply to this job with 59%, do you think I'll get the job? Just type in a yes or no in the chat. Do you think I'll get the job? 59%. Oh, sorry, I think I clicked on the attendance again. I was going through the charts to see what you were typing and I clicked on it. Um, sorry, let me open it back. Okay, so 59%. Do you think I'll get the job? I'll get the interview. Festus says no. Mrs. Zambezi says yes. It's impossible for you to get called for an interview. Okay, a big no. Charles. Charles says a big no. You're not going to get called for an interview at 59%. It's just impossible. All right. So what do I do? I'm going to optimize the CV. Okay. Maybe I should even show you what the CV looks like. And then I would optimize the CV. So let's see the CV before optimization and after optimization. Okay. Before and after. So let me open it up. This is what the CV looks like. I just changed the name, of course, for privacy and so on. So you can see I'm a data analyst with experience collecting, cleaning, analyzing data, the technical skills, the core competencies. This person actually indicated that they work as a healthcare data analyst with Amdari in the UK, and they listed what they've done. But again, it's not an optimized CV for that job. The person has a bachelor's in industrial chemistry, University of Lagos, 2016, and so on and so forth. They've also worked as a personal care assistant, supported clients with daily living activities. So you start to see that apart from the work with Amdari, there is nothing related to data analytics from previous work experience. Even as a client experience representative, again, I just changed the name of the company, Monument Bank, responded to customer inquiries, maintained customer records, escalated complex cases. It really doesn't add any value to the job I'm applying to. And that's where the tailoring becomes important. Okay. So what do I do? CV Matchly, do the magic for me. All right. So I tell CV Matchly to do what? Optimize my CV. Okay, generate optimized CV. So you can generate either a Word document or a PDF and click on generate optimized. And when it generates the optimized, it downloads it for you and you can go ahead and bring it up. Okay, and I'm going to show you what the optimized CV looks like. Would upload the optimized CV and you'd see the difference. 59%, that was what we got, with the initial CV. And then we will do what? Optimize and re-upload. So let's wait for it to optimize. It's optimizing. It might take a few seconds to get that done. And it's a lot faster and better than when you use, other tools that make it look too AI-like. And you don't want to have that. Okay. Let's wait for a few seconds more. While that is going on, if I click away now, everything disappears. Okay. So optimization completes. Download optimized CV. So I'm going to click on that, download optimized CV, and I'm going to bring up the optimized CV so you have a look at it. Okay, let's see what the optimized CV looks like. So I'm going to open the optimized CV and let's see what it looks like. All right. So that's the same CV. I downloaded this just now, and you can see the same CV optimized, professional summary. I'm a healthcare data analyst. This is more tailored. Okay, if you look at it, you'd see some things with the NHS aligned information governance. And why do you have that there? And it's fine. Of course, you still have to go through it to be sure that you don't have anything that you can't explain. But you've worked with NHS data during your training and you can speak about them. Okay, your core skills, your technical skills, and your experience. Now, if you look at the experience, even though you worked as a care assistant, you still get to work with patient records. You collected records of patients. Even when you worked as a client experience representative, you worked with a CRM. And this shows that you have experience utilizing systems that stores customer data, patient data, and so on. Initially, you had no metrics to quantify your achievements, but now you do. Okay. Now I'm going to take this CV and I'll re-upload it again. And let's see by how much would this CV match. Okay. So um, I'm going to re-upload. And this time around, I'm going to choose the optimized CV. Okay. Optimized CV and analyze. So the first one was 59%. Let's see what the optimized CV would give us. And I would ask the question again. If we applied with the first and we applied with the second, which one would likely give us a better result? This is 96%. So if I apply with this CV, I want you to tell me, do you think I'll get called? I'm likely going to get called for an interview. Yes or no? The second one, Abby says yes. Okay, let's get more feedback. Yes, yes. Are we tired? Ethan says absolutely yes. A big yes. Rahima says yes. So now you start to see the reason why some people fall through the cracks and they don't get called for an interview. So I'm going to take that CV and that's where I would copy my job history with Amdari. So if I go back to my application, I hope I didn't close it. No, I didn't. Okay. Brief description of your duties and responsibilities. I'm simply just going to copy what I have, Amdari, copy everything that I've done on that CV. Um, okay, just give me 1 second while I copy and I'll paste and you'll see how it appears. So let's copy that. Copy and I'll come here and I'll paste as text. Okay, so you can make adjustments. Okay, so while I worked with Amdari as a healthcare data analyst, what did I do? Okay, I designed. Two, I developed ETL pipelines. Remember, they want somebody that understands SQL. So ETL pipelines using SQL, using PostgreSQL, and so on and so forth. I built and developed and delivered Power BI and Tableau dashboards. Do you remember where you saw Power BI and Tableau dashboards? Let me remind you. Okay, if we go back here and we look for I know we saw it somewhere the other time. I can't just remember now. We're looking at something and we saw Power BI dashboards. Okay, yeah, that's it. Experience with data visualization tools. Example, Power BI, Tableau, dashboards. Okay, so you start to see that your application is coming together. So you fill all that, make sure you have spacing, it's easy to read. And what do? Save and move to the next. All right, save and move to the next. Do you have any gaps in employment? If you have gaps, explaining gaps in employment is a different ball game entirely, but we teach you how to do that. Okay? We teach you how to explain gaps. However, if you don't have a gap, you don't need it, you don't need to explain anything here. Just say none. Okay, save and next. Then it comes back to your supporting statements. Your supporting statements. A lot of people generate supporting statements using ChatGPT, Claude, Gemini, and the rest. Again, this is where CV Matchly shines. All right. Remember, we've used CV Matchly for the job. We've tailored our CV and it moved from 59% to 96%. And because it is tailored, we copied the job requirements and pasted it. Now I need to generate my supporting statement. CV Matchly will do it for me. So I'll go to my dashboard on CV Matchly. So CV Matchly, AI. Okay. And I'm going to go to the website. Click on that. It takes me to the website. I'll have to log in with my credentials. Okay. Enter my password. Yes, I remember. No, that's not my credential. Okay. So let's see. Login. Now, what CV Matchly does is every single job, every single thing you've optimized, every single job you've applied to, CV Matchly tracks it for you. So if I go to my job application tracker, excuse me, I'm going to see the clinical data analyst role I just optimized my CV for. What do I do next? I click on these three dots right here. Okay. And I would say what? Generate supporting statement. So from my CV Matchly, whenever I apply, I can come here and say I have applied and it would move to applied. If I've gotten an interview, it would move to interview. Rejected, it would show in rejected. If I get an offer, it would show in offer. Okay. So let me close all of this. So now I want my supporting statement so I can submit my application. So I come here, generate supporting statements. Okay. So this takes maybe like 60 seconds or 90 seconds, and then we have our supporting statement. Okay. So once it's done, I'll just download supporting statement. And once that is downloaded, you'd see what it looks like. So supporting statement generated. So I come here and I click on download supporting statement. So here I have my supporting statement. Okay. And your supporting statement is so important. It's so important because this is where you sell yourself. And everything in your supporting statements must what? Must align with the person's specification and the job description. How you were able to take ownership. Your supporting statement has to show how you displayed strong organizational and time management skill. It has to show how you were proactive and solution focused. So everything that you have on the person specification, ensure that you have that as well. Okay. So you have your supporting statements. I'm going to copy this. All right. I'm going to copy this. Of course, you want to go through it and be sure that what you have fits what you're applying to before you go ahead and put in the application. But I come in here, I paste. Remember, you also need to make adjustments, okay? Where you need to have paragraphs, put the paragraphs right there. It's easy to read and so on and so forth. Okay, so at Amdari, I developed an automated Power BI dashboard and so on. Okay. Um, so once you are done with all of this, all right, you're done with all of this, you go ahead, save, and you're pretty much getting closer to the end. Further questions. So they are asking to confirm if you used any AI tool in any part of this application. Okay. So you have two options. Yes, I will be using. No, I will not be using. You don't need to lie about it, okay? CV Matchly utilizes AI in generating this stuff for you. And most of the time, you also use CV Matchly to do what? Not CV Matchly, ChatGPT, Gemini. Some of you would use that to summarize certain things within the job application process, okay? So you can say, yes, I'll be using Save and Next, okay? And like I mentioned, it doesn't mean that they would disqualify you for using AI. All right. It doesn't mean that that's what will happen. All the information you provided, it's accurate because you're going to sign off on that and so on. Are you a member of the UK Armed Forces? No. Click on save. Okay. And that is done. That section is done. That's the section that usually has the most, number of applications to fill. Mark section as complete. Then reference. You come in here, enter your references. Again, this is where having a reference that meets that has that particular job where you said you worked as a healthcare data analyst or as a data analyst, I'll provide you with a reference. This is where you provide the reference detail. Okay. So I'm going to fill this very quickly. Okay. Organization's name, Amdari Inc. Job title. You remember what you used in your application that you were filling. What was the job title? Head of Analytics. That was what we used. Okay. How do they know you? Former employer, line manager, and so on. All right. UK address, type that in. So let's search. Let's use the postcode to search. EC1 V 2NX. So 128 City Road, London, and that's it. Enter the phone number. Can this referee be approached prior to the interview? Yes. Period that this reference would cover. It covers from whenever you worked. I think that was we selected June, right? 2026 or thereabouts to December 2026. What name will the referee know you by? They'll know me by my normal name. My name is Biola. If different from your current name, they know me by Biola Fast. That's my name. Is not different. Not different from my normal name. Okay. And I click on save. That is also complete. Then equal opportunities. That's pretty much straightforward. Okay. So it's pretty much straightforward. Just asking about your race, your gender, and so on. Date of birth, you enter that. I'll put random dates right there. Okay. Indicate your gender, male. What best describes your marital status, married, single, your ethnicity. I'd simply choose that. Describes how you think of yourself. Heterosexual. If you're bisexual, you write that as well. Okay, heterosexual, of course. Please indicate your religion, Islam, Christianity, Judaism, Islam. Save and next. All right. According to the definition of disability, are you disabled? I don't wish to disclose. Yes or no. Save and move. All right. And this is just your socio-economic background. All right. So what was the occupation of the main earner in your household when you were 14? Senior middle management. What type of school did you attend? I attended a school outside the UK. I attended a state-run, state-funded school. Prefer not to say. These are not used for the, assessing if you are qualified or not. The diversity questions are purely for workforce statistics. They are not scored. They're not part of the shortlisting, and the recruiters don't even see them when they are assessing you for an interview. They don't get to see this part. So you don't need to worry too much about it. Okay. Were you eligible for free school meals at any time? No. Save. Okay. How did you find out? I found out on the NHS website. You can select that NHS jobs, save and next. Declaration is where you declare that the information you've provided is accurate, you didn't falsify, and so on and so on. Click on save. And when you've done that, mark the section as complete and you go ahead and do what? Shoot your application. I'm not going to be submitting because I'm not applying. You want to view, you can view your application and see everything you've entered step by step to be sure that you've not made any mistakes. You can download and keep, but you really don't need to download. Do you know why? Because if I go back to CV Matchly, I can always come back here. I can now select I've applied. Okay. I've applied. So now it is under applied. I can come here and say, I want to see the CV that I used to apply to this job. I want to generate a cover letter, or I want to do what? I want to view the link to the job. So if I click on view job link, it takes me to that particular link to the job that I applied to, clinical data analyst. So gone are the days where you have to create folders and save multiple files simply because you're applying to jobs. When you do things the right way like this, what happens? That is where you start to get jobs and you start to get opportunities. Remember, the reason why people struggle to get jobs, they use generic CVs. They use generic supporting statements. They ignore the job requirements. They lack measurable impacts. They don't use the STAR method. This is a very important one, the STAR method. So your supporting statements was the things you had there were generated using the STAR approach. And what does the STAR approach mean? S is for situation. Okay, situation. So why did you have to solve that problem? What was the situation? T is for the task. A is for the actions you took. R is for the results it gave. Okay, so the way I always advise, especially when it comes to the NHS, the simple formula you can use is this. There was a problem. And when that problem came up, what did you do? You took responsibility of the problem. And when you took responsibility, pardon my writing, what happened next? There was an action you carried out. What action did you carry out? You used Excel, you used Power BI to build a dashboard. That helped to reduce reporting timeline. It helped to increase revenue. It helped to give full visibility on our operations. And when you carried out that action, what was the outcome? This is how you answer questions, even during interviews. Okay, during what? Interviews. So a lot of people don't use this when applying, and they just use generic chat GPT generated content, and that doesn't give you results. So your winning strategy is to tailor your CV, tailor supporting statements, always check the person's specification and the JD. You saw that evidence of your impact. When you did a particular task, what did it result to? Always answer with what? The STAR approach. Very, very important. And those were the things Ikma did. And the final thing she did, of course, I've said this so many times, she had a reference. She had a referee to provide her with references, which I did. So she listed me as a reference, and the NHS reached out to me. Dear Mr. Deza Suleiman, Ikmat has gotten the job. We want you to provide a reference. Give us your opinion regarding her suitability. All right. And when you've done 1, 2, 3, 4, 5, 1, get into a high demand career path. 2, learn the right way by learning in a project based environment and also by building a portfolio to showcase your work. 3, gain work experience to show employers are the best candidate for the job. 4, know where to apply and how to apply. And 5, you need a reference to keep that job. These are the things you need to get a job. And there are so many other people that have landed jobs. All right. Not just within the NHS, but also with the civil service. All right. And what do you do when you get an interview? What happens? All you have to do is go to your dashboard. You don't need to call anybody. You don't need to have a conversation with anyone. Just go to your dashboard. I'll show you what that looks like. Okay. Go to your dashboard and you simply do what? You book an interview prep. So this is what your dashboard looks like. So for those who registers, and I'll show you how that plays out, you have CV Matchly right there on your dashboard for free. Okay. You have an interview coming up. What do? Click on schedule mock interview and you fill all the details, the stage of the interview, and somebody would prep you for that interview. So what we do for you goes far beyond just learning the skills. And this is your LMS. So on a Monday, Sunday, Friday, you have, 30 minutes, 1 hour during the day. You come in here, click on continue learning, and you watch your videos at your own convenience. Okay. You want to learn Excel. You want to learn Excel operations, Excel Paste Special. You click on that. It takes you to the video and you are taught by the best professional in the game, the co-founder of Tenalytics, Efemena. Okay. And that's how you get to learn. This is what your dashboard looks like. You have access any day, anytime, anywhere. Okay. So what we do for you goes beyond just learning. You learn the skills, we package you and present you as the best candidates for the job. So from how you tailor your CV to your LinkedIn optimization, gaining work experience, how to build a portfolio. I showed you what the portfolio looks like, to your mentorship sessions. You have mentorship on Thursdays, and let me show you how amazing the mentorships are. So in your classroom, you have access to your mentorship. Now, your mentorship is where we bring in professionals that are in that career path. They've gone ahead of you. They come back to handhold you. We had a session this last Saturday, overcoming imposter syndrome. I took the session. Okay, so you'd see me right there. Again, if you miss this session, you can always come back and watch the recording. Okay, so if we click on that, you're going to see me teaching how to overcome imposter syndrome. Okay, a very, very interesting session. It was super, super amazing. Okay, this is what your mentorship looks like. All right, how to write NHS supporting statements, how to secure the global talent visa, how to tailor your CV for different healthcare roles, the body mentorship, strategies to tap into the hidden job markets, LinkedIn optimization. These are your mentorship sessions. And of course, I talked about the job reference, the interview prep. And when you get the job and something seems a little bit difficult for you, we work with you, ensure we don't breach any data privacy rules, and we show you how to get the job done, the questions to ask, and how to approach a problem. And finally, how to apply and where to apply. I showed you a lot on that already, and that's what gets you the job. That's what so many people. Sharon was a customer service professional. Today, she works with the HMRC as a risk data analyst. Esther was a care worker. She joined us in April 2025, and by July, 3 months after, she got a job with the UK government legal department as a contract project officer, and so many other roles within the civil service, within the NHS. This is the HMRC. Elizabeth did business analysis, and she got this job as a business analyst with HMRC in August last year. Richard did a agile project management program, and he got a job as a project support officer with the HMRC. Francis got a job with the Department of Works and Pension as a data quality officer after completing data analytics. And there's so many of them. Also in the US, you have Pavel, a Cameroonian who had experience as a teacher. He got a job as a healthcare data analyst. And I'm sure you know how he did it. He learned in a project-based environment. He built a portfolio. When he applied to jobs and he got interviews, we prepared him for interviews. I worked with him to negotiate his salary for this particular role as a healthcare data analyst with the Arizona Community Physicians in Tucson, Arizona. You have Emmanuel, who got a job as a senior operations consultant with the Bank of America after completing financial analytics. So I want you to listen to all these amazing professionals and hear from them and how they were able to make the transition. Abednego, a Ghanaian who moved to Canada, joined our data analytics program, got a job as a quality improvement analyst. Amaka got a job as a HR data analyst in Saskatchewan, Canada. Toyin got a job also in Saskatchewan as a project coordinator after completing our agile project management program. And you have in other regions in Nigeria, Christian got a job after data analytics. William got a job in Poland with Marsh McLennan. William was undergoing his master's when he registered. He got a job as a junior strategy analyst. Chukwuebuka got a job in cybersecurity, and Vanessa got a job as a data analyst in France in November last year. Now, I'm going to play a video from Ikmat because I spoke a lot about Ikmat, and I want you to hear from her how she got this job, what the recruitment process was like, and how you can also start your journey today. Okay, so let's listen to Ikmat very quickly, and then I'll tell you how to start today. Okay, so let's hear Ikmat. Sit back, relax. It's a 3-minute video, very straight to the point, and it's super, super exciting. You heard a lot about ICMAT today. The question is, how did ICMAT transition and get that job as an information analyst? So hear from ICMAT yourself and learn one or two things.
I was with the match called Intel Analytics, and joining Intel Analytics has been the best decision so far. You know, for me, someone coming from a background of full housewife, because I had to stay back home to look after my child for parents, and then wanting to break into something new, wanting to go back into the workforce, you know, wanting to place myself in society for better job opportunities. So it was a lot. And then I'm glad that Tenalytics came along, and then they presented me with so many opportunities right in front of me, better opportunities. And then I'm glad I took it. And then uh, also the advice of not sell yourself short, that if it's always need, it's very, very valid, because place yourself right, you know, don't sell yourself short. It's very, very, very valid advice. You know, in analytics, they will hold your hands like a child, you know, through the models. You have the opportunity to go back and study. You have the opportunity to go back and practice. You have the opportunity to ask questions. You know, you have people you can always go back to, even outside of class hours. It's the most amazing experience so far, really. And then another thing is the interview prep, guys. That is another very important thing. I did my interview prep with Mr. Mohammed, and it's the best decision ever, because he was like, he saw into the future. He knew what was going to be asked. And I'm glad that I wrote down all the things he mentioned and went back to practice. And then when it was time for the interview, it was like everything he was mentioning, everything he mentioned, it was just, they kept on. And then when I was answering those questions, I was so confident, you know, because I already practiced. I did an Excel test, I did a math test, and then they were really impressed. And another thing is that it may not come as fast as you expect. Definitely, you're going to get some news, and then you will begin to think you're not good enough. You are good enough, yes. The news will come, but always take it as a basis for learning and development, because after every interview where I got a no, I always make sure I get a personal feedback. So I work on those feedbacks for my next interviews. And yes, it worked. It really worked for me, because I got my first job 3 months into the program. First job. I couldn't take up the job because there was a student and I was only eligible to work 20 hours. So I couldn't take up the job. 3 months later, I got 2 jobs with full business sponsorship. And guys, all the other no's before the 2 jobs prepared me for the yeses I got. So yes, the no's will come, but do not give up, because you always have analytics to go back to. They are the best, yes, and the best thing that's ever happened to me. And then yes, and they are the most affordable. The most affordable one I've come across so far. That's the very good advantage. So yes, analytics for the win.
So that's amazing, Ikmat. All right. I was going through the charts while Ikmat's video was playing, and I saw some of the questions which I'll address when we get to Q&A. All right. Ikmat, you heard from her 3 months into her training, she got that job. Okay. She had a limitation while she was in school. Of course, if you're in school, you can only work for 20 hours per week. Her first offer she couldn't take, but when she completed the program, she got 2 more offers. So she had 3 offers, and she went with the best one that gave her all the opportunities. All right. Our next cohort starts on the 4th of July, and you have the opportunity to join the next cohort. Okay. And I'm going to walk you through, for those of you that want to start, I'll walk you through how to start today. What you need to do to get started today. And for those, I saw some questions around, I need to see more, I want to see more references or more testimonials. That's totally fine. If you stay back, I'll show you more. There are so many, I can't possibly show everything in a single session today. All right. So for those who want to start, I have 2 amazing offers for you, or 3 amazing offers, 3 actually, and I'll bring them one after the other. So the first one is a massive discount for those who want to start on the 4th of July. The original amount for you to start in any of the program is almost £1,000, £957. So for the health tech programs, that's healthcare data analyst, healthcare business analyst, healthcare project manager, and then the data analytics, the business analysis, and agile project management. However, you have a whopping 21% off. You save over £207 and get to pay just £750. And the beauty about this again is you don't have to pay in one full installment. You can pay in up to 5 monthly installments. So what this means is to start your journey today, you need only £150 to start. That's the first amazing offer. Okay? £750 is what changes your life into a career path that is progressive, and you get an opportunity in 2026. But there is more. I have more for you. Now, the discount is available for the first 20 people that registers from this session. And the first 10 people to register also gets free access to CV Matchly. I demoed CV Matchly. You see what CV Matchly does for you in the application process. And this is not just for the NHS. It works across Indeed, Glassdoor, CV Library, any job board you can think of. You can use CV Matchly on that job board. So you're going to have it for free for the first 10 people that will be registering today. And then I'll take you to the third offer. Okay, so the first offer is instead of £1,000+ you get to pay just £750, and you can make your payments in up to 5 installments. So what you need to start is £150, right? And you have the first 10 people get access to CV Matchly for free for 3 months. 3 months for free. So what this means is when I log into my dashboard on the LMS, I would see CV Matchly like this. So if I go to my dashboard, I'll see CV Matchly and I can start using CV Matchly. All right. Now, the third offer is this, and I'll take you to how to make payments, and then I'll show you what the third offer is. So my colleagues would share the link in the chat. Remember, the discount is not available to everyone. So what we usually see is people come back to complain, to say, hey, Adeza, I missed out on the discount. Can you make it available to me? So it's available right now. If it's something you want to get started in, you've always wanted to get into data analytics, you always wanted to get into healthcare data analyst. You've always wanted to become a business analyst and you didn't know how to start. This is your best opportunity to start. All right. So once you click on the links my colleagues would share with you, it takes you to the enrollment center, and I'll show you how that works. So you get into the website. First of all, I just need to enter. Just give me 1 second. I'll enter my password, login, and then I'll show you the exact same thing you'd see. You don't need to enter a password when you're registering. It's straightforward for you. But I'll just show you how to get started from your own end. So you can see exactly the same things that you'd see when you're trying to register. Okay. All right. So I just copy this and paste. Yeah, you heard that sound, right? So we have a hackathon coming up. That's it right there. So that's the sound you heard, but I quickly had to pause. So when you come here, you go to Start Learning, and under Start Learning, view all courses, and this will take you to all the courses available. Now, I saw some people in the chat asking, I want to see more of data engineering, more of this, more of that. What I've shown you today a career path that are non-coding career path and career path that will get you into the NHS the fastest and get you sponsorship. That was what I showed you today. So there are more career paths you can consider depending on what you want to do. So data engineering, for example, for the person asking for data engineering, you can't be a data engineer without coding. You will code. You'd have to code. Not everybody wants to code. Not everybody wants to start coding at this point in time. So my session today centered around non-coding career path. So let's say you decide to go for the healthcare agile project management program or healthcare business analysts. All you need to do, select the program you want to register for and click on enroll. Okay. So once you click on enroll, it takes you into the payments. You have to create an account, and it's very straightforward to create an account. Okay, so I'll show you how this plays out. So you enter your name, enter your email, enter a phone number. All right, read the terms and conditions, and then you sign up. All right, so the moment you sign up, you can go ahead, select the cohort you want to start. So you can start in July, you can start in August. You still enjoy the discounts and all the freebies that comes with the discounts. But let me show you the amazing third offer that I have for you. All right. You can also toggle your currency in pounds, Canadian dollars, euros, and so on. Okay. So I'm going to select pounds. Okay. Now, this is the third offer I have for you. The first offer, you have the amazing 20% off. The second offer is you have access to CV Matchly for free for 3 months. And what I always advise people is start your learning, learn for 3 months. After 3 months, you have some skills required to start applying to jobs. You start utilizing CV Matchly to apply to jobs, and you have 3 months for free for CV Matchly. The third offer is for those that pay once, you make a one-time payment where instead of paying £957, you get to pay once. You save the 21% off an extra discount. Instead of paying just 21% off discount, you get up to 32% discount and save £242. So instead of 957, I'm paying just 715 and I'm saving £242. But that's not where it ends. You also get full application service after the first 3 months. Do you know what this means? All the work I've done today applying to jobs, we apply to jobs for you. We do it for you. We tailor your CV, your LinkedIn, and all of that, and we apply to jobs for you. And we guarantee you 2 interviews. And this is after your first 3 months. And this is because we want you to have gained enough skills to do the job. We can get you the interviews. That's not a problem. But we want you to get the interviews and we want you to get the jobs. Okay. So we want you to have enough skill to convince potential employers that you can do the job. So after the first 3 months, we guarantee you 2 interviews. We have a full do it for you service until we get you 2 interviews. And you also get into the founder circle. That's the third offer. If you make a payment in 2 installments, which means you pay £375 today, you pay the next £375 the next month, you save £207. You also get the full job application service after the first 3 months, and we guarantee you 2 interviews. So just like the one-time payment, we keep on applying for you until you get your 2 interviews. That's the promise you get from us. And the 5 monthly installments is the most flexible, which means I can pay £150 today to start, and I break the remaining payments in the next, 4 months until I complete £750. So here you are saving about 21% off, and you save about £207. You also get the full application service, but you get this after the 5th month. So one-time payment and 2 monthly payments, you get full job application service after 3 months. For the 5 monthly payments, you get full job application service after 5 months. So you all enjoy the same. You get guaranteed 2 interviews. Okay, we guarantee you 2 interviews, and you also join the founders circle. So that's the third amazing offer. So you don't have to worry yourself. Your first interview is not your worry. We'll do it for you. Your second interview is not a worry for you. We do it for you. And these are the options you have. So if I select any of the options, say 5 installments, all I need to do is I select confirm my information is correct. I've read the terms and conditions, and I click on pay now. Confirm my details, click on pay. Okay. And then I enter my card details. All right. Very straightforward. So I'm just going to show you how this works. Okay. Enter my full name, my region, and then I click on pay. And the moment I click on pay, you get a confirmation to your email. You would also get directed to your dashboard. You have to complete your onboarding and a couple of other things. So payment successful is going to direct me to where I'll complete my profile and so on. Okay. So here I have to validate my email, verify my email. So I'd simply come in here and verify my email. It's an OTP. So you check your spam just in case you don't see it in your inbox. So 368. So I verify, create, my profile, verify my email, enter my country. You select the country, gender, time zone, British summer time, enter your phone number because this is the phone number we will use to verify your number is correct. Okay, so preferably it's a WhatsApp number and so on, because you would get an OTP as well. Okay, so preferred class time. When do you like to join your class? I want to join 11 a.m. in the UK. Select that. Emergency contact, just in case, we don't see you in class and we have to chase you to come to class. You enter an emergency contact right there. So you have people that check up on you. They're sure to be sure that you're doing everything you need. You have everything you need. If you miss classes, there's somebody checking up on you the following day and so on. Emergency contacts. I'm just going to enter a random number. Okay, so you enter a number of an emergency contact. How did you find out about us? Oh, I saw you on your website or on LinkedIn. Enter your LinkedIn URL. Okay, and then you verify your phone number. So you get an OTP to your phone number as well. Okay, and once you verify your phone number, you get directed to complete your onboarding. So your onboarding is where you get to watch this video. It's a welcome video from me. Select I've watched. Once you're done watching, and then you go to meet the team. All right. So you meet your team members. You have their phone numbers, the team members that you'll be working with, and so on and so forth. This is Francis. Francis is a senior. I paid for the healthcare business analysis program, right? Francis is a senior business analyst in the UK, and this is somebody you get to work with, and so on. Okay, so you work with amazing professionals that get you into the career path you want to move into. All right. Once you are done, you know who is your cohort lead, you know who your facilitators are. What do you do next? Okay. And this is you just completing your onboarding. So you install Excel, you install Power BI for Mac, Power BI for Windows, and PostgreSQL. Okay. So these are the tools you need for the first day in class. So you have videos you can watch to help you install. If you are done installing, you select, I have this tool, I have this tool, I have this tool, I have this tool. You click on next. Then you look at the class etiquettes, and communications and so on. You view the terms and conditions, make sure you attend classes and so on and so forth, because that's important. If we apply to jobs for you, before we even apply to jobs for you, we want to be sure that you can do the job. So you're attending classes, you are not missing classes, you are completing your projects, you're completing your assignments, and that's how you get access to that service. So when you get those interviews, you know exactly how to do the job because you have been attentive in class and so on. Okay. So you click on next, you complete everything, and then how to escalate if you have any questions or stuff like that and so on. And once you are done with all of this, it takes you into your dashboard. Okay, so while I was speaking, about 3 payments came in already. So I have about 7 slots left for CV Matchly. Okay, 7 slots left for CV Matchly and also the job application service. Now, something I want to show you before I take questions. Check the chat for questions. Something I want to show is when you have, because you're going to have problems, okay? You're learning something new, you are always going to ask questions. Now, when you miss a class on a Saturday, one of the things people always struggle with that I've heard them say in sessions like this is, oh, Adeza, I've trained somewhere before. I had to chase my trainers, I had to chase my teachers around, and so on and so forth. You don't chase anybody here at Analytics. Okay. So on a Monday, on a Tuesday, on a Wednesday, there is something you are studying and you don't understand. And you want to meet with a real human being to say, hey, look at look at what I'm doing, look at what I'm working on, and advice on what I should do. You can book a drop-in session. So you can do that either from your LMS or you can do it from your classroom. So book a drop-in session, you click on the link, and you would see from Mondays to Friday. So on Monday, the 22nd, I can book a call and a professional will jump on a session with me, look at the problems I have, and guide me on how to solve that problem. And if I check the first link and I don't see any data available, I go to the second link. All right. So there's always somebody available. So this is not available, for example, but the first is available and I can join a class. I can join a session on a Monday. I'm available on a Tuesday. I want somebody to look at the problems I have and so on. That's a technical drop-in. Then you have the employability drop-in. So somebody in at the beginning of the session said, I'm a nurse. I want to become a healthcare analyst. When you've tailored your CV, and you have questions. Oh, I have experience as a support worker. Should I have it on my CV? Should I take it out? I have employment gap. What should I do? All you need to do is book a drop-in. Come in here, employability drop-in, click on that, and one of our career coaches would guide you on what to do. Any day from Monday to Friday, you have access to not just the technical support sessions, or technical drop-in. You also have support on employability. And these are the things we've put in place. So you are never lost and you are never confused. You always know what to do. All right. And we have something called the job sprint. You see that right here, job sprint. What I did today to make sure you apply, because a lot of people are lazy to apply. So we set up a session, we get you on the call, and we apply together. So it's called the job sprint, similar to what I did today. But it's just what I did was including other things, explaining and training, and it took so long. But for the job sprint, we go to a job, a particular job, we click on it and we start to apply together. Okay. And this is what it looks like. So the focus for us is a lot more than just technical. The focus is on ensuring that you get the job. Okay, so this is Amaka. Amaka Daniels is the lead, the data analytics team lead. So if you're in healthcare data analytics, you're in data analytics, Amaka is your lead. Amaka is also in the UK, just like yourself. So she understands all the things you need and so on and so forth. Okay, so you have your job sprint is very much practical. You apply to jobs together and so on. And this is her showing you also how to use CV Matchly. Okay, so I'm going to take a breather. I'll take questions in the chat. I have 4 payments that have come in so far. So I have 6 more slots. I have 6 more slots. Is the fees inclusive of Amdari experience? Yes, it is, Ethan. So once you complete your 6 months, you have moved straight into Amdari. Okay, you move straight into Amdari. So Amdari is where you get to do your work experience after you've completed your learning. Okay. Let me see. So Mrs. Zambezi is asking if payment is paid by June end. If payment is paid by June end, Mrs. Zambezi, you'd miss out on the discounts. You can pay anytime. You can pay even in October. We have cohorts from now till the end of the year. You can pay anytime you want. The difference is the discount is available for the June cohort, and for those, the first 20 people to register get the discounts. The first 10 gets access to CV Matchly, so you're going to miss out on all of that, Mrs. Zambezi. I hope I answered your question. Let me see if I have more questions in the chat. Okay. Is it just data analytics? There's so many more success stories. You see this slide I'm sharing with you. Let me share more success stories with you. Okay. This is Sharon. Sharon is the healthcare assistant I talked about that moved from a healthcare assistant role to a business data analyst. Sharon is Kenyan. She moved to the UK as she's Kenyan. She moved to the UK as a healthcare assistant, but today she's a business data analyst. All right. She kept her sponsorship with the NHS, the same trust. Okay. So she joined our business analysis program in March. And by May that same year, she got a job. Okay. You have somebody like, let me look for other career path. Um, this is God. God is data engineering, also works with the NHS as a data warehouse and ETL developer. I think I showed you Esther earlier. Esther joined Agile Project Management. She works in the civil service in the UK. You have, let me look for more people. You have someone like Sonia. Sonia is a HR analyst. Also in the UK, you have Idris. Idris is a data engineer. Idris Adebisi, I'm going to show you his journey and how he moved with us. In fact, Idris is about to get another opportunity. But let me show you Idris' story. Idris joined us, data engineering. He got a job with Jaguar Land Rover in Coventry. He moved from Jaguar Land Rover and he moved to a job in London. So that's Idris Adebisi right there. You can see you both worked at Analytics. Idris worked with us as a data engineer. He got a job with Jaguar Land Rover in the UK, and he got his most recent job as a senior analytics engineer. All through the process, we prepped him for his interviews. We wrote his references for him. And that's the beauty of being a part of the Tenalytics community. You have access to employability services. So even after you've gotten a job and you get a promotion, we work with you to help you get to that next level. You have Chika. Chika did financial analytics. He's doing amazing stuff. Currently works in the UK as well. Um, you have Evelyn. Evelyn was a nurse with over 15 years experience. Evelyn also did data engineering. She transitioned into data engineering. This is Dr. Arome, medical doctor who is now a data analyst. I showed you Toyin's profile multiple times. All right. This is Sandra. Sandra got a job as a data protection paralegal. She joined our GRC program, and I'll show you Sandra's profile very quickly. So this is where Amdari's referencing also becomes very important. Sandra Stevenson. Okay, so that's Sandra right there. Sandra, you'd see Sandra worked as a GRC analyst with Amdari. So she listed Amdari as a work experience. She got a job as a data protection paralegal with Hello DPO in the UK. All right. So these are different career paths. And for those who would like to watch more videos and see more professionals that have done amazing stuff, there are so many of them. Okay. And I'll show you how to get access to them. All you have to do is go to YouTube. Once you go on YouTube, search for Tenalytics on YouTube. Okay. Search for Tenalytics on YouTube. Click on the logo and it takes you to where you have alumni job success stories. Okay. If you click on that, you have 188 videos to watch. You can spend the weekend instead of you can binge watch all the 188. You get to see different professionals. This gentleman is in the UAE in Dubai. He got a job after, joining one of our programs. You have Mr. Ola, who got a job. He worked with the Home Office He worked with the civil service for over 25 years. He got a job with the Home Office at the age of 60 after joining our business analysis program. All right. You have this gentleman who is in Egypt and got a job with IBM after joining data engineering. This gentleman got a job as a financial analyst after joining our financial analytics program. Um, Toyin got a job as a project manager. Judith got a job as a business analyst working remotely for a company in the US. This is Emmanuel, works with the Bank of America after completing financial analytics. You have so many professionals, numerous professionals. Chukwebuka got a job in as a security operations analyst after completing cybersecurity. So you have amazing professionals, over 188 people. Ty also got a job in cybersecurity. This lady got a job in data science after completing our data science program. Oluwafikayo got a job as a business intelligence analyst in Canada after completing our data science program as well. So you have so many videos to watch and so many testimonials. There's just so many I can keep on my slide. Okay. So I'll check the chat for more questions if you have more questions for me. And I'll check to see if I've met the 10 slots I have. And then we start to call it a day. Okay. Let me see. Okay, so I have 5 payments coming so far. 5 payments coming. I have 5 more slots left. Okay, 5 more slots. So I'll take questions. And you can stop the recording, Daniela and team, so that the video is not too long for those who want to make payments, who wants to